Hi, everybody. Thank you for being here on the Transatlantic Call-In Show, where you get to talk to real-life trans people about trans issues and also politics or things, anything like that. Talk about all kinds of stuff, and learn about the world. I'm Josie Caballero, and I'm joined here with Dr. Ben. How are you, Dr. Ben?
No, I'm doing all right. I started, what is it, like 22nd grade now that I'm back in school again. So that's
Oh,
that's a thing going on. No, I'm really
22nd
I'm
grade.
yeah, well, I'm using my VA benefits. So I was like, if they're gonna kick me out of the military, at least I got my GI Bill. So I'm like, I'm gonna use that money that's on the table. But
You
how have you
better.
been, Josie? Yeah.
Oh my gosh. I am busy as always. Like I literally was I gave a presentation at the Creating Change conference that's happening here in DC. And then I then came all the way back to my house so I can go and do the show for all of you. And then I am then going back down to finish doing stuff. So yeah, it's been busy. And then we also just give a little update on I don't know if you know this, Tucker, we actually had a fundraiser. Me and Forrest did a little fundraiser calling Cus I Wanna last Saturday, and we raised I think a total of about $5,500 when it was all said and
Wow.
done. Yeah. So
Incredible.
and the update, I'm sure a lot of audience members that may or were there, we ended up getting every state in the union to donate some dollars. So
Wow.
we literally have donations from everywhere. Wyoming was lagging, but they gave I think a few hours after the show ended, so it must have been somebody watching. And I actually literally texted that person and was like, "Thank you so much. You did it. You got us to the 50 states." So it was a lot of fun. And the fun news about the report that just came out too, we were the number 3 fundraiser out of 13 candidates of money raised. And so we beat the incumbents. So we're
Wow.
creating a force here. So it's exciting. So anyways,
Yeah.
and I'm wearing like my pink on salmon. Like I'm like going full political Barbie right now, which is fine. Which is fine.
Yeah, so
So
I know we were talking backstage kind of about some of the other people running for office, a lot of them who are trans, a lot of them who were part of this wave of people getting kicked out of the military. Um, can you kind of share some of those names as well? So if people are in
yeah.
those areas, they can vote.
So we have retired Colonel Bree Fram, was a colonel in the Space Force in Virginia, just announced running for Congress, was kicked out of the military for being trans. You also have Sarah Clem, also a vet in the military, from the military as well. In Pennsylvania, you have Lindsay Church, who's running as an independent. They are running in Illinois, in the Chicago area, I believe. They're incredible, huge veteran advocate as well. And yeah, we have a lot of trans folks across the country that are stepping up and running for office. We like to say elect the dolls, but elect all trans people as well. So
Yeah,
yeah, it's really exciting. It's really exciting. People are ready for change in leadership. So that's what it's all about right now. So yeah,
absolutely.
it's good stuff. It's good stuff, you know. But yeah, so you ready to just get into it? Let's go into the last week's poll.
Let's do it.
All right. Should states be able to ban trans girls from sports teams even if they've never had male puberty? And we got a 90% that said no and 10% that said yes. So what are your thoughts?
Yeah, I mean, I feel like we have similar thoughts on this that I would say no, they should not be able. I mean, they shouldn't be able to ban trans girls in general just for being trans. But I know that this is in reference to the whole argument that um, you're just inherently going to have some kind of advantage by being assigned male at birth, and that the current bans and the current rules are targeting blanket groups of people, even and not considering the specific factors that may give somebody an advantage. So, um, yeah, I don't think they should be allowed to do that. I'm in a similar boat as Arden and many other people that have spoken about this issue. That if you're going to make rules, they need to be across the board for cis people as well.
I agree. I agree. And if you are part of that 10% that said yes, go ahead and call in and tell us why you voted yes. And so we can make sure that you get your point of view across as well. This is all about trying to call in and making sure that we do that. Great. So let's go to this week's poll, which are trans people the group most targeted by the administration? I'm very curious to see what people say to this.
Yeah.
So yeah, let's see how the audience votes, and then we'll go back to it on that. Um, and so if you have not liked or subscribed, please do that. Do that now. It's incredibly important. We are nearly at 200,000 subscribers here on the line. So it would be really great to be able to hit that soon, just to show the support for folks that try to have good conversation and a skeptical point of view, so we can make sure that we help continue to educate people across the country and world. So if you do want to call in, make sure you call in at 720-619-2288, or you can use the web link in the description, and we will prioritize calls that are maybe a little bit more controversial, or maybe in less more of a disagreement about our existence as trans people, or just any type of policy. If you think ICE is justified doing what they want to do, you can talk about that too. I'm always happy for a good conversation. So yeah, please go and do that. So let's go ahead and take our first call. We have Jocelyn, she, her pronouns, from Oregon. Yeah, you were watching a previous episode of TACIS and wanted to share some research. So yes, tell us about it.
Hi. Wow,
You're
it's
live
me.
on the
Oh my
line.
God, I've never done this before. Well,
No worries, you're doing great.
first of all, okay. First of all, abolish ICE. Screw those guys.
Yeah.
Um,
Mm.
Second of all, I saw on Luxander's stream uh, from, I think it was an episode from a couple of weeks ago, but it and Dr. Ben, or it was talking about some research that they had seen that suggested that being trans was some kind of intersex condition, maybe. I don't know if y'all know what any of that was about, or if you can send me in the right direction, but I'm just really curious about that.
That was what the caller said, I believe, right? Where they were trying to say that intersex should possibly be considered. I'm sorry, being trans should be considered intersex in that way. Is that what I'm recalling? Is that
I mean, I
correct?
could be misremembering. Hmm?
Oh, okay. Well, I do remember saying that sometimes when you go on HRT, you're kind of putting yourself into an intersex, like you're like doing that to yourself, but like a condition, but it's not necessarily actually intersex. But I'll pass it over to Dr. Ben if you want to talk about it.
Yeah.
Sure.
I don't remember the exact thing that was said. I don't know if Lux was going in more of a direction of like something neurologically that could be considered like
Right.
intersex. But if we're talking about Lux's particular argument, I don't want to strawman anything, and I don't want to make assumptions about
Sure.
what Lux was talking about. I think that question, I would recommend calling back when Lux is on, because then it can kind of help
Dang it.
you walk you through a bit more of that. I'm not aware of specific research suggesting this at this time, but I also
Okay.
haven't looked super heavily into it. So I wish I could
Yeah.
offer some
Yeah.
more on that, but
Well, maybe I'll try to call back when it's on. Yeah, it was something. It was a call with like Damien or something from Canada. He was being a goofy thing about sexism and whether or not trans people were sexist. I guess I do have like a little bit of bone to pick with y'all, if you don't mind, if you
Sure.
have a couple of seconds. Um,
Take away.
Sometimes, and I hate to call out any people specifically, but Josie, it seems like you do this a little bit more than some others. sometimes like it seems like you kind of play into the framing where trans women are kind of like biologically male in some way, and I don't know if you do that like for convenience sake or if it's something that you actually believe. But I don't know. So for some reason, I feel like that kind of is detrimental to trans people in the cause.
Sure. I don't say I'm biologically male. What I say is I was assigned male at birth, and my gender is woman, and therefore I'm a trans woman. That's what I say. So,
Okay.
and a lot of callers they try to conflate sex and gender a lot.
Yeah.
And so what I try to do is try to show them the reality that there is a distinct difference between the two. I don't deny the fact that I was
Right.
assigned male at birth. That's never been my bailiwick. That's never been the thing that
Sure.
I personally do. So I don't think I'm giving into any framing by just stating the reality that I was assigned male at birth. And so for me, I would never say I'm biologically male. I would say that I was assigned male at birth and I my gender is woman and I am a trans woman, which is a type of woman. I would not say that I'm not a woman, right? Like anybody who
Sure.
would say, "Oh, you're a biological male," I would push back against them and say, "Well, actually, I am a trans woman. I'm a woman." And so being biologically male has no significance in reality because that has nothing to
Yeah.
do with my gender. And so therefore my sex assignment is what it is. Is that just to clarify, that's usually how I state it. If I've misstated it before, then I apologize, but that's my statement.
Okay. Yeah, because I will metaphorically die on the literal hill that I am biologically female, and anyone who disagrees can go screw themselves. I am an adult human female. Screw y'all.
I mean, yeah, I mean, like for me, it's like I'm not going to give into the framing that, I am
Okay.
a biological male. I was assigned sex at birth as male, but I
Right.
am a trans woman, so my gender is woman. But Ben, do you have anything you want to add
Yeah,
to that?
I think like just the argument that is often used for biological male or biological female is such a attempted trap of an argument to get you to
Yeah.
say something like it's to bait you into
Sure.
denying what you were assigned. And so I think it's just better to avoid that phrase altogether. I think Josie's approach is
Right.
appropriate and pretty much what I would do, and making sure that maybe we're staying away from that phrase and being more clear about what we
Right.
mean. Um, so there's definitely a lot of philosophical arguments that we can go down of like, yes, transition does change your biology, and like there's a lot of
Yeah.
nuance within the biological side of it. I think getting into some of that nuance can be less helpful in discussions with people who don't know the difference between sex and gender. So I think it's often more productive to just clearly delineate between those two and not really like not just have the argument
Yeah.
over the word biological. So
Right. Yeah. I don't know. I've maybe I, I could be. I don't. I have a fever today, so
No.
I don't know. I just
that's
I
commitment for
think I've seen a couple
calling.
places. Do what?
That's commitment for calling while you're not feeling well.
I
Yeah.
know. Yes. Try very strong. I don't know how you say that in another language. Yeah, I think I just seen a couple times somebody describe like XY genotype as being male genes or something. I don't remember. Or chromosome from there's words. Okay. I'm bumbling now or
Yeah.
rambling.
No,
I
no.
don't know what I'm doing.
No worries. And Justin, I would just say this too. It's like your lived reality of who you are is completely
Sure.
fair and valid, and I think anybody that tries to argue with that type of framing is just it's just a waste of time for the person who tries to do that. and
Yeah.
and I will and this is one thing that I know, and maybe this is my political brain speaking here, is
Yeah.
we are all part of this big community of trans people, right? and
Sure.
and we we as people don't represent the trans community. We're just ambassadors of the
No.
trans community. And so it's not we as folks should never have to defend every person in our community when we're having conversations. So like for
No.
example, there's a lot of folks in fact in the last call in the calls that I was doing on Saturday with Forrest, there was a
Huh?
person who was straw manning me like the whole time where they were like, I've talked to a trans
Mhm.
woman that said this. And I was like, I'm like, talk to me. I am the trans woman standing in front of
Yeah.
in front of you right now. Talk to me. And they would refuse to engage with the actual trans person and just try to
Yeah.
engage with another trans person that they're trying to hypothetically make an argument for instead of actually engaging with the actual arguments. And so just remember that like always argue from your heart and who you are as a person,
Yeah.
and just and we as a community can use each other's argumentation or other ways that we say things to help us be able to be stronger in our own rhetoric. But remember, the rhetoric is your own, and so
Yeah.
that's the way that I kind of look at it. So yeah, stay hope you get feel better.
I will do my best. One of the things I'm trying to
Yeah.
do just real quick, I'm part of like this trans non-binary group for my company, and so I'm trying to just like get out and be visible and humanize us, and I'm trying to throw as many resources as I can at them and as many of my arguments that I can come up with and life experiences. So maybe making myself a
Absolutely.
target, hopefully not. But anyway, thank y'all. I
Yeah,
appreciate
well,
everything you do.
thank you. Yeah, stay safe out there, okay?
I'll do my best, you
Right.
too. Oh, good luck on your campaign.
All right. Oh, thank you. All right. Bye.
Bye.
All right, we got a spicy call in the queue right now.
Oh, we
If we
do.
want to jump
Okay.
right
Do you want
in.
to jump right in or do you want to do the poll first?
I don't
Jump
want to
right in.
lose this caller, so I think we should
Fair,
jump right
fair,
in.
fair, fair,
Let's do
fair,
it.
fair, fair. So we have Tim, he, him from New York on the line. Hello, Tim. You are live on the line with Dr. Ben and Josie. How are you?
Hello, hello, people. I'm well. I'm great.
Good,
I hope
good.
you're
So,
okay too.
yeah, so would love to talk about the issue that you are asking about. So yeah, tell us about it.
So I'm like I said, I'm skeptical of underage people being given sexual reassignment surgery and puberty blockers as well, because I think that they can have harmful effects.
So, Tim, you are on the phone with a doctor right now, so it's your lucky day.
Sure.
What surgeries do
Sure.
you believe are being done on people underage?
Well, I can give you a specific person that's quite famous. Jazz Jennings was given puberty blockers from I don't know the exact age
I
they
wasn't
started.
asking about puberty blockers. I was asking about surgery. What surgeries are
Okay,
happening
well
to
they
people
were
underage?
she was given sexual reassignment surgery at 17, so
No, I want to know
that is
what you
underage.
mean by sexual reassignment surgery. Are you talking genital surgery? Are you talking top surgery? I need to
No,
understand what you understand about the situation before we proceed.
genital surgery.
Okay,
Okay.
okay.
Just general surgery.
So,
That's the answer. Yeah, go ahead.
okay. So, uh I'm not particularly aware of that particular case, but it's not within the standards of care to offer genital surgeries for people who are underage. So if we're talking about skeptical of the guidelines and what's being done, sure, there may have been a very, very fringe case where it may have been appropriate to act outside of the guidelines, but there are no guidelines I believe globally, but it's primarily in the United States is where my knowledge is. There are no guidelines in the United States that allow for genital surgeries for trans people under the age of 18. So the larger medical community would agree that that is not something that is appropriate. So that seems to be not a real issue for this discussion. Are you on board with that?
Um, I believe there are quite a few cases at 16, 17, but however, I think just talking about the puberty blockers is enough to have a discussion. So if you want to move on from that, that's
Okay.
fine.
Yeah.
Sure.
Yeah, we can do
Yeah.
that. I'm happy to
And
talk
and
puberty
I
blockers with you.
and before you go there too, Tim, before or Ben, I do want to talk about like I am happy to hear that you don't believe that gender affirming surgery when it comes to like genital bottom surgeries are happening to minors more often than not. They're just not happening, and a
Yep.
lot of times there's a lot of fear tactics that are done in this regard that is not helping the position of the fact that that's not actually what is done. So when we get into the puberty blocker conversation, I just want you to know that we are coming from this in the best faith possible because when we as trans people are talking about these type of procedures, it's in the trans community's best interest that we get it right. Right, because if we were going as hard and as fast as, a lot of people think we are doing with trans related healthcare for minors, then it wouldn't serve our best interest because we'd get it wrong a lot. So right now, and I did a research study, the US Trans Survey, surveying 92,000 trans people across the entire United States. And right now, when it comes to gender affirming care, the rate of people who are satisfied or somewhat satisfied is 98%, right? And it is incredibly high of satisfaction after getting transition related healthcare. So I feel that that's very important for our community to keep that satisfaction so high, because we do not want to have high regret rates either, because we want people to get their good standard of care. So I just wanted to say that before Dr. Ben goes into the science of what puberty blockers are and why we prescribe them.
Yep. So,
Or,
so Tim, what
I'm
is your
sorry.
particular issue with puberty blockers?
Sure. Oh, okay. So they are the children are often given puberty blockers when they're at what they call Tanner 2 of their sexual
Yep.
development. And what happens specifically in this case with Jazz, and what happens often, is that their genitals do not become fully developed. And then by the time that they have the bottom surgery, they are unable to make a neo vagina out of their genitals, and they have to use the colon because
Yeah.
their genitals are,
That is a risk.
underdeveloped.
So that is a risk. So there are risks and benefits to any medical procedure that you undergo or any medical therapy that you receive. And so we're getting into a very complex issue of medical consent. And I don't know how familiar you are with the laws and with the regulations on who can make consent or who can give consent, what they can give consent for, and all of that. It can be a very sticky, ethico-illegal sphere. How familiar are you with that kind of thing?
Well, I don't have a background in the medical field, but I think that I can have a moral discussion about it without necessarily
Yeah,
being an
so
expert in the medical field.
who should be allowed to consent to their own medical care?
Uh, well, when you look at the sexual reassignment surgery, you're saying, well, we don't do that until they're 18. So why do you not have
Yep.
the same perspective when it comes to these puberty blockers that can permanently alter their genitals and
So
damage them?
this is so there's a lot of nuance as far as consent with adolescents. And so when you hit Tanner stage 2, you are entering puberty. Usually it's somewhere between 9 and 11 years old where you kind of start that process. And so you're getting into the range of adolescence where you're not really a young child and you're not really a grown adult. And there's a lot of ethical stickiness that happens in this particular area, because they're starting to be able to identify things for themselves. They're starting to be able to make their own decisions of what things that they want. they're still, in most cases, are not able to consent to any type of medical care. There are some exceptions. But when a minor undergoes any kind of medical care, usually it is their parents that is consenting to that for them. So this isn't just a child willy-nilly making a decision and then a doctor just goes ahead and gives them puberty blockers. They are not able to consent to that kind of care on their own. So when a child goes in to the endocrinologist to be getting puberty blockers, it's their parents that have to make that decision to bring them in for that consult. So really, it is the parents that are doing the primary consenting. It's the medical team that's advising them and helping them decide if this is the right thing to do. There's also psychotherapists and psychiatrists on board trying to differentiate, is this gender dysphoria or is this something else? Is this child likely to benefit from this care? Is there going to be risk reduction from giving this? For example, if somebody has higher risk of suicidal ideation, they might need earlier intervention compared to somebody who is lower risk on that. So that's going to play a factor. But of course, the child is usually the first one to initiate these conversations of wanting to go through transition. However, it is this whole team that is there to make the decision of if this care is appropriate and if consent can be given in this case. There are some like weird sticky places, and I don't want to go there just yet, but are you kind of tracking where I'm at with this?
Hmm. I see. There are some nuances with consent at an age where people are coming of age and they might have some kind of greater level of independence. You're saying. I see what you're saying.
Yeah.
And
And
can I? Oh, go ahead,
yeah, Josie,
Dr. Ben. Go
jump
ahead.
in, Josie. Go for it.
Yeah, I just want to also mention as well, Tim, like, do you know when this point of puberty blockers is even normally being done? So like, for example, like, what is the process before puberty blockers are done? Do you know?
I would imagine counseling.
Yeah, that's right. So it's counseling and actual pediatric psychology as well. So it has to be a diagnosis of gender dysphoria before they even move on to the puberty blocking stage. So it's actually quite a lot of time, about usually minimum of a year, before the parents are going to this step with the child, where the child wants this step from happening, because you have to have that diagnosis, so therefore we are very sure that the child is a trans person, right? It's a very important step, because we're not giving puberty blockers to any kid that just walks into the nurse's office. This is a very difficult medical decision that families have to make. It's a very intimate decision that they have to make with their doctors, because they understand what the effects of the puberty blockers are. So I just wanted to mention that as well, that this is actually a very hard process to even get to the point where they're offering the puberty blockers at all. I just wanted to jump in with that. Go ahead, Dr. Ben.
Yeah. Any thoughts, Tim?
I understand what you're saying, that there are a lot of protocols and precautionary measures. However, I don't think that at that age, whatever information they're being given, that they have the sufficient knowledge to take and I'm not even sure whether they're being informed of that kind of consequence. Um, if
They
they
are,
can
Tim. Tim,
make the
this is what
decision.
we just discussed. Tim, this is what we just
Okay.
discussed about consent. So let's take a
Okay.
different example. So let's say we have a child that needs some kind of like a child needs their appendix out. Do you think the child has to be fully aware of what's going to happen before the parent can consent to that surgery?
No, I don't think that's comparable, but okay.
Okay,
No,
but
so it
let me jump in really quick. I'm sorry. So Tim, you realize that the puberty blockers is the reason, what you just said about giving kids more time to contemplate this decision. The puberty blockers is the reason why we offer them. right? Like if there was no puberty blockers, then they would immediately jump to cross-sex hormones right away, which are more non-reversible because puberty blockers are 100% reversible. So if you go get off puberty blockers, then your puberty just starts like it does normally. So the reason we put puberty blockers in place is to put pause so we have more evidence and more data to support that the child's gender dysphoria is going to persist through their entire life.
Yeah, and I want to
Okay, but
mention some stuff here.
Mhm.
Yeah, here, Tim, you go ahead real quick, and
Go
then I
ahead,
want to
Tim.
add some more to
Tim.
that.
However, I don't think that puberty blockers actually function like an on-off switch. I think that I don't know that it's
Yeah, Tim, do
possible
you know the
to
mechanism of puberty?
perfectly
I can talk about that. Do you know the mechanism of a puberty blocker?
um specifically. I don't know what you're getting at exactly. Could you explain it to me?
Yeah, do you know what it means to be a GnRH agonist?
So an agonist, that's not an activator. That's
It is
it
an
is an
activator.
activator.
It
So
is an activator.
okay.
So yeah, so
So
it sounds
that
like you're not
stops it
you're
from
trying to make
binding to the
decisions.
receptors.
You've made it, Tim, you've made an opinion about a drug that you don't know anything about, which is very interesting to me. But so Lupron, or Luprolide, which is the generic name, it's a GnRH agonist. And so it's a gonadotropin releasing hormone agonist. And so it utilizes your own body's endocrine feedback to pause puberty. So you naturally have GnRH, that's kind of similar to growth hormone, but like for your reproductive organs. And so that's going to signal to have testosterone and or estrogen release to kind of propel you into puberty. If you have a lot of that hormone, you can actually cause higher amounts of estrogen or testosterone to be released, and then those high amounts will do what we call feedback inhibition of the whole process. So it actually causes a surge in your reproductive hormones first before it causes inhibition. So you're right in saying it's not like an exact like on off switch. It is just utilizing this pathway that we already know has an inhibitory mechanism. And so in that, we can remove that agonist, we can remove that surge, and then everything goes back to normal. So we're just relying on a regulatory pathway that people already have.
But are you I don't believe the modern science is confident that when you do switch it back on at a different age than it
No, we
would have been
are.
expected.
Um,
We
and
are
so, Tim,
confident.
this is something that I think is another misunderstanding of the pharmacology as well, because in the cases that you're talking about, especially where people have so there is some risk that like just from the puberty blocker alone that you might have less genital growth if you were to just stop it and undergo your endogenous puberty. However, the cases that you're mentioning of people that are 16, 17 years old, something different is happening with them, because that is not just the result of puberty blockade. That is puberty blockade followed by or kind of in conjunction with cross-sex hormone therapy. And so that's where you're going to get less growth, is because if you have somebody who goes on a like 1 to 2 year trial period of a puberty blocker, the goal isn't to keep them on the puberty blocker. The goal is to either stop it and start them back on their regular puberty, or it's to start them on cross-sex hormone therapy at a rate that is appropriate for their age group. So if you have somebody, let's say, who is a trans girl who gets on a puberty blocker and then switches over at the right time to estrogen, of course, that person is going to get less genital growth because they are not getting that testosterone influence that they normally would have. So I think it's problematic to say that the puberty blockers are doing this complication when this is a combination of medications that are leading to that effect. And so,
Yeah.
yes, if you have somebody that goes on that full process and does not undergo their endogenous puberty, sure, you can have some restricted growth, but that's something that you talk about early on, and it's not necessarily inevitable for everybody. So it's really important that that we discuss this uh, accurately with these medications.
Yeah, and I also just want to add really quick to that point of the fact is puberty blockers were not created for trans people. Puberty blockers were created for cis people who started puberty too soon. So, like, let's say you're, an 8-year-old kid and you're growing a full beard, right? Because puberty started too soon. Or if you're an 8-year-old, kid and started your period at 8 years old, 7 years old, then they would pause that puberty and they would pause it for a lot longer too. Not they
Mhm.
would probably pause it for several years. So we actually have more studies and more evidence of younger kids being on puberty blockers for a longer prolonged period of time. And guess what? Those kids have grown up into human beings with the sex they were assigned at birth and the gender that matches, and are cis people who have had kids, had family, had long lives. We already have the sustained evidence that puberty blockers has helped their lives in a very significant way that doesn't have all of these prolonged problems when we talk about trans people. So we have deep medical clinical research of adults that have been on puberty blockers for multiple years longer than any trans kid.
Yep.
Um, in those cases, don't they typically try to stop precocious puberty because they think it can stunt their growth? For instance, is that
Yes,
That's
that's
far
why
as
one
they,
I
of
know?
yeah.
the reasons. Yeah.
Yeah, that's why you're given puberty blockers for precocious puberty. That's why it was created. It wasn't created for trans people. It's just that it can be used to give families more time for their kids to understand who they are before they decide to put people through cross-sex hormones. So when they get to the point where they're ready to get off of those puberty blockers, because you want to get them off of it because you want them to develop and be, go through puberty, then they make that decision. And if you're a trans girl and you go through, estrogen treatment at an age after you're done with puberty blockers, you have standard breast development. You don't have the voice that drops. You don't have the broader shoulders and the aggressive height growth. You are don't grow the brow bone and the stronger jaw. So all of those things are incredibly beneficial to the quality of life as an adult for a trans person to have the only have to go through puberty one time. A lot of trans people, when they're adults, have to go through puberty again. I had to go through puberty twice, right? I had to go through once when I through my male sex birth, and then I had to do it again via the trans woman that I am. And guess what? I had to get facial reconstruction surgery, right? I had to do voice training. I had to do laser hair removal for my face for the last 5 years. In fact, I got another appointment on Saturday. I'm still doing this, and I've been going through my transition for over almost 6 years now, and I still have to go through this massively painful process of removing facial hair because I wasn't able to get the option of doing puberty blockers. So I'm going through more pain and more dissatisfaction of having to do extended medical care through my adult life. If I was able to get it when I was young, then I wouldn't have to have all of these evasive surgeries, right? And I would have had my natural breast growth that would have started at a younger age, and I probably would have a nicer cup size. But, I'm happy where I am with my own body. But, those are the things that are beneficial for starting puberty sooner. And so when you were talking about, and look, I really find it interesting and that you care about the sexual satisfaction of trans adults because of whatever medical period process that they go through. And I guess that is somewhat benevolent of you to think about, the sexual satisfaction of adults to go after they grow up. But at the end of the day, like, there are massive breaking edge breakthroughs in medical technology and science that is allowing a lot of adults that are going into gender affirming surgeries through for bottom surgery, that are going through, even with fully developed puberties, opting out for different types of surgical options. It's nice to have a variety of different options and tools. Just like, when somebody goes in for a hip replacement, the doctor doesn't say you're only getting this one. They have many different procedures laid out on the table, and they say, okay, we can give you this one, we can do it this way, we can do it that, we can do, like, there's all these different things. I know many trans women that are adults, in their 30s, 40s, 50s, that have gotten robotic, bottom surgeries where they use a robot and they do it laparoscopically, and the robot actually does all of the things that happens, and they're incredibly happy. Or you have trans women that want to do it more traditionally, that has that uses more of the tissue that is already there. You also have a hybrid of the two. You also have cis women that don't have developed vaginas because they were born with a condition that doesn't allow them to have a developed vulva and vagina, that go in and get the same type of surgeries that a trans person does because there's no tissue there at all, and they have to create their own and use the intestinal lining. By the way, it's the intestinal lining on the outside of the intestine. It's not the entire intestine. Like there was already misinformation that you were saying there. It's literally the connective tissue between your organs is what they're using. They're not using like your actual intestine. So like there is a lot of really cool research that is done. So we are already, as a community and the surgical medical community, coming up with better ways to do the surgery regardless of how someone developed. Does that make sense, Tim?
Yeah, it makes sense. Could I possibly get another a couple questions in?
Yep,
I
sure,
hear
go
what
for it.
I do understand what you're saying. The science is developing. I think that the fact that the science is developing is what makes it not necessarily forthcoming to a child who's being told, "Oh, you just are the opposite sex that you were assigned at birth."
Tim, that's not
So
what's
I
happening
think
though.
that the
And it seems like there's a misunderstanding of how the medical system works, how research works, because there are multi-stage trials that things go through. And it's not like when we say that science is still learning, we're not in infancy of these therapies. Like we are well into a place where we have established gold standards. And then the things that are developing are how do we make things better than the current gold standard. So this is what happens with all medical research. There are things that are developing that we're very, very comfortable about. And some of that might be even as small as, what's the right amount of oxygen to give somebody that's in respiratory failure. Like we know respiratory failure exists. We know how to manage it very well, but we're fine tuning a lot of things to be better and give better outcomes, and especially better quality of
and
life outcomes. So I think it's problematic
may I
to
make a,
look at the fact that science is continuing to learn and think that that is a negative.
may I make a statement?
Yeah.
Sure.
Um, well, the individual at the time who goes through these medical interventions, and do you think that they necessarily have an understanding at 12 years old or 11 years old when they're being given those puberty blockers? Even if they're being told, do you think they have the requisite understanding to say, okay, I'm going to take this risk that my genitals will be underdeveloped and we have to do this alternate
Yeah,
method?
a lot of
Yeah.
times, yeah. It is a
Yeah.
joint discussion with the child. And I think you're giving adolescents you're kind of infantilizing adolescents in a way. I've worked with adolescents. I've provided gender affirming care to adolescents, and it's a decision that needs to be on an individual basis. Like you can't treat the whole population in the same way because yeah, some of them might not be ready to understand that type of decision, but others are. And so this is why, again, it's this ethically sticky area because we don't have really set in stone guidelines of these are the exact criteria you have to meet in order to be considered able to make these decisions, right? Like this has to be uh like the best judgment of the whole team. And
Yeah.
so yeah, there is some nuance there, and I don't think you're giving people enough credit for what they are able to understand at that age. And when we are getting informed consent, because even though this isn't a true like informed consent scenario, because you have parents consenting as well, um but there are ways to gauge whether or not somebody is able to adequately consent to a procedure, and part of that is a teach back. Are you familiar with a teach back method?
No, I'm not.
So if I'm going to be explaining a procedure or a treatment to somebody, usually I ask them to repeat back to me what they understood about the risks and the benefits, like and what procedure is happening, what you were expecting from this, and all like what are the risk benefits, all that. So if they can explain to me in their own words what's going on, what the risks and benefits are, it's pretty clear that they understand what's happening and that they're ready to agree to it. So if you have somebody that isn't able to repeat that back in their own words, then maybe that's not something we want to go forward with because they're not ready to understand, and maybe we need some more time to think about it. So I think you're maybe misunderstanding the layers of care and attention that goes into this type of patient interaction. And I get that it's difficult to understand because the work that doctors do is not easily seen. Like you've had your own experience with doctors, but it's hard to understand what goes on in the rooms with other people. And I just want people to maybe be a little bit more cautious about trying to have opinions and making decisions about what other people should be allowed to do in that room with their doctor when they don't really fully understand that either. So I get that you like your heart's in the right place, that you want to take care of people. I just don't think you have enough understanding of the scenarios in order to really have well-formed opinions on this. I do appreciate the
And
questions though.
And,
yeah,
and
I just want to jump in really quick too, Tim, about the thing that you were talking about when it comes to the kids knowing. And by the way, we are going to be having to stop the call soon because we are running long. I will say this. So a child understands the concept of the fact that if they don't get puberty blockers and cross-sex hormones, that they're going to have their voices drop, they're going to grow a beard, and they're going to, get tall and have broad shoulders and look like their dad. Right now, I'm using that exact rhetoric because I know a trans girl that literally was crying to me and her aunt about the fact that her sister, and her sister was being mean to her, but that's what it was. Kids are mean to each other. She said that you're gonna look like your dad and you're gonna grow a beard, and it's and this poor girl, not even knowing anything about the medical system yet because she was only 7, and was like crying to us saying, I don't want to look like my dad. I do not want to look like, I don't want to have a beard. And so the reality is, kids even at that age know that they don't want to look like their dad or they don't want to look like their mom, right? And that is much more important to the mental health of a child when it actually comes down to what actually happens. I cried when my voice dropped, and I still thought I was a cis kid. I didn't know that existed at the time, and I literally was bawling my eyes out in like junior high when my voice dropped, and I was like, I hated it so much. I hated how it made my head vibrate. I hated everything about it, and so for me, as a person, if I was told, "Hey, you're gonna go through this thing. These are all the things that can happen, and if you do want to pursue bottom surgery, because it's usually a pursue that happens a lot later, is like these are the type of things that you're going to have available to you. And there are a lot of human beings that have these surgeries already that live happy, healthy, sexual lives." and have these type of surgeries. I know many trans women that had all types of different bottom surgeries, for example, that have very happy, fulfilling sexual lives with all these different types of surgeries that exist for people's bottoms. That's the reality. It's not like there's no option. It's not like if you go through puberty and you go through puberty blockers and you go on cross-sex hormones and you never have the puberty of what you were assigned at birth, you're not going to have a sex life. And so Tim, I want you to think about that deeply, about the fact that your sex
M-
life is not over because you
May
decided to
I
go
ask?
through a
Sorry,
yeah, go ahead.
one last question.
Uh-huh,
Um,
go
eh,
ahead.
to Ben, you mentioned all the precautions that they take and that they inform the patient. Can I ask you, are you confident that in all these cases where they did have that side effect and they had to use the alternate method of reassignment surgery, do you think that in the majority of those cases that they had were briefed with the proper understanding to make the decision that they did?
I would assume so. I was not in the room, but it's. I think that's kind of a. I'm trying to be nice. I think that's kind of a dumb question because, uh, sure, yeah, people should be giving like up to the standard of care, uh, like consent talks with their patients, and that's what we're literally taught to do from medical school, in residency. Like that is a standard part of the job. And yeah, there are doctors that are shit at doing that, and that's not an issue with the procedure. That is an issue with their professionalism.
Yeah.
So, do I think that doctors should be doing their jobs and adequately counseling their patients before a procedure? Yes. I think it's kind of a bit problematic to assume that that is an issue just with
So
trans care. Like, do you think that would you go on that same line of thinking about knee surgeries or even about labor and delivery at the hospital? Do you think that people
ah,
just shouldn't be allowed to have babies because maybe they weren't like given
they
the best
chose a
counseling
different
at the
way of
hospital?
doing it.
Yeah.
Yeah, and Tim, I just want to add this too. Like, you don't understand the process of what bottom surgery is like. Like, you know how many months of study I did personally to figure out which gender bottom surgery
Mhm.
process I wanted to go through? Like, it's like I had so many options of the way that I wanted to approach my bottom surgery. There's no alternate or less worth way of doing it. They all have their benefits, they all have their cons, right? The one that I assume you're alluding to, which is the one that is like the most like basic one, the one that the first surgeries were done at the time, which is the pull through print like one, that surgery has a lot of negatives because you have to dilate more. It's more painful. It's more you have to be more aggressive with the recovery process, while the other types of surgeries are less painful when it comes to the recovery process because there is more things to it. And so Tim, like, and look, like, I can go into graphic detail with you if you would like about the different types of styles and thoughts about going into these type of surgical cares, but I don't think that's really your contention here. It's not just because you have one less option of surgical care doesn't mean that that person's quality of life is going to go down. In fact, I sometimes I'm like, man, I wish I chose the other type when I see my friends who are trans, or like, oh wow, they have that surgery. That's a really cool. That's really beneficial for them, right? That they have it that way. And there is like a lot of people that have a lot of different stories, and it just they just choose what works best for them and their lifestyle that they want to live. And it's not like one surgery is less than the other. And so I want you to get that out of your head. Like, these surgeries are all surgeries and they all produce the same result. They give you a vagina, and that includes cis women that don't have vaginas too. And so like, that's the end result. You go into the doctor's office and you're like, I want a vagina. Okay, great. What type of surgery do you want to have that vagina? I don't know. Let me research them. What are the pros and cons? Okay, these are the things that you do. And the surgeon is like, actually, I'm not very good at doing that surgery. Maybe you should go to another surgeon that actually is more proficient at that type of surgery. Like it's like anything else, Tim. Like this is a very complex personal decision that is made because they are trans. This has nothing to do with, oh, I don't know, because I was given medicine early in my life, so therefore I'm not. That's not what our minds are going. We're like, we need one vagina, please. That's what we're doing. And that is what we do, and we then talk to our doctors to have that intimate discussion. So just get it out of your mind that there is a lesser version of vagina surgery. There isn't a lesser version. They all create a vagina, and it's just how they want to get there is the difference. Does that make sense?
I understand what you're saying. I get where you're getting at. I wouldn't agree exactly, but I
What do you
understand what
don't
you're
agree
saying.
with? What do you not agree with? Tell me.
I think it's impossible for two surgeries to be 100% equal. Obviously,
I didn't
Tim,
it's a
say they're equal.
prototype.
Tim, Tim, I find it kind of insulting that that doesn't even know the mechanism of the drug that you are against people using, are really want to tell people what medical care they should have, and what doctors should be allowed to do for them. Like, it's hilarious to me. Like the Dunning-Kruger is as astounding.
Well, okay,
I don't know if you understand like the amount of
I
expertise like these surgeons get to be where they are, and like
Like
I
I
don't
just
think you
want to
could. Yeah,
I
go
just
ahead,
want to say
Josie.
that I just want to say this, Tim. Like doctors don't sit there and say this surgery is a better surgery. It's like this surgery
well,
has pros and cons. This surgery has pros and cons. Which pros and cons do you want? That's how people
is
go into surgical care. That's not about like what is more
is
better than the other.
Josie, is every current surgery a prototype? Isn't every current
No,
reassignment surgery?
Tim,
No.
Aren't
we
they trying
already
to
went into
improve?
this. Tim, you weren't listening earlier when I talked about how medical like innovation happens, and it seems like you want to live in Dunning-Kruger land and think that you have
Oh yeah,
enough
I think I'm
knowledge
very
to
smart,
tell people
but
what
I'm
they
actually
can and
very dumb.
cannot
Okay.
do under their doctor's medical care. Yeah, like
I mean,
it's very insulting to me, Tim. Like this is my life's
Mhm.
work. And
So this,
I don't
I,
like when
I, I
people
just want you to answer
armchair
my question,
quarterback
please.
something that they do not understand.
it's
Hello.
so Tim, like what like the thing is like I feel like you're dancing around the words like prototype and things like that. Like trans women that go through the surgery, and I'm using vaginas, and this happens for trans men too, or anybody that needs to have a bottom surgery. It's about having the piece of the body that doesn't align with who they are as a person in their mind. That is what we think about when we have this. Like just because science and procedures change, and there's robotics and there's all these different things that happen. I mean, it's the same thing with hip surgeries. Like there's and different things. It's like we can go the classic way that we've been doing 100 years, or we can do the way that is more modern and new and has a different way of doing it. And
Hmm.
your pain might be more here, but it may be less here, or so for me, it's like I'm not sitting around talking about, oh, my prototype vagina. I'm sitting here talking about my vagina, right? Like that's how it works. It's
Hmm.
like trans people aren't going around being like, oh, I don't have a real vagina because it's a prototype. Like that's not how this works. If we have a active sex life and we have happy intercourse of whatever we're for whatever reason we're doing it, then it's a successful surgery
Sure.
because it does the job.
Um, hmm I just to say that everything is equal when they're trying to improve is just
That's so
that's just my
okay,
thought.
Tim. So stop using any medicine, stop going to doctors, stop going to the ER when you get in an emergency, because if all medicine is at some stage of improving itself. So if you think that because
Hmm.
something is improving, therefore it's a prototype, you could just not get any medical care and that's your business.
Well, I try to use preventative care and be healthy in the first place.
Preventative care is
Sure.
also something that is
I've never,
undergoing constant revisions. If you
yeah,
sat through any AAFP meeting or read through their guideline, the guidelines change very frequently because we learn more about people's healthcare and how to do it better. Right?
Yeah,
Like
and
if you
Tim,
want to sit through
I just want
the
to say this.
boringness of yeah.
What preventative care could I get that gives me a vagina? Tell me, please. I would like to know.
that was a response to Ben. That wasn't a response to anything you said.
Okay, but you understand that has no place in the conversation we're trying to have. There is no preventative care that
Well,
gives me a vagina. That's
Mhm.
why the fact is my result that I desire is a vagina. So no matter what, I'm gonna have to go through some surgical care to get that. That's just how it works. And whatever procedure
Sure.
I choose in my personal life to get there is my choice. And those are the things
Yeah.
that I have to deal with because, like any other person that gets any type of surgery, they
And
have to deal with the consequences of making a choice.
yep. And you're an adult and you can give consent without a doubt.
And we've basically said that these bottom surgeries are not happening like 99.9% of the time to anybody under the age of 18.
Okay. And like I said, the puberty blockers can have their own impacts, and you guys admit that
Tim,
there's
stop
debate about
Tim,
whether it's
I am
sufficient.
tired of you
I know.
because we addressed all this
Okay.
and either you didn't listen or you're not understanding it. And
Okay.
you are
Yeah.
continuing to Dunning-Kruger your way through things that you
Okay.
don't
Yes.
understand. You
I'm very dumb, and
came
I
in here
think
to
I'm
All
very
right.
complain
smart.
about
All
No.
right,
Tim,
Tim.
we're
All
done.
right,
We're
Tim.
done, Tim.
Yeah. All
Okay.
right.
Have a
Have a
nice
great
day.
day.
Bye bye.
You too. Bye bye.
I just want to give a tip to the people out there who want to disagree with the medical consensus. At least at the bare minimum, know the mechanism of the drug that you are so opposed to. Like at least do a little bit of reading and understand what specifically you're against, because that is just wild. Like to not know the
It's just it's
medication
it's
and then
just
to
weird
say
to
that no one can
me.
use it.
Like it's such a weird way of argumentation to say I care about the sex lives of trans people, so I'm going to force them to go through, beards and shoulders and deeper voices just so they can have a better sex life. It's like get out of my pants. Like I don't give a fuck. And like the idea that there's like, "Oh, well, I want the best sex, so therefore I better have the biggest dick." Like,
Right.
it's like what the fuck? Like it doesn't even matter like at all. Like it's really frustrating to me that type of argumentation of like I just want to look out for the sex lives of the future 12-year-olds. It's like come on, dude. Like we have methods of getting vaginas to people who need them regardless of where they come from, and the idea that they're like I talked to a cis woman who didn't have a developed vagina once, and I was having I was at a wedding, and she knew I was a trans woman, and she was a friend of a friend that knew that I had bottom surgery, and she came up to me at this wedding and she was like, well, just having a great conversation. And she was like, "Oh, by the way, doesn't dilating suck?" And I was just like, I looked at her. I'm like, "Yes, it does. It's awful." And she was like, "Yeah, I had to do it for X number of years because I wasn't born with a vagina." And I literally looked at her. I was like, "How many of your friends know that?" And she was like, "No, I never talk about it. It doesn't matter to me. I just wanted to tell you because I had solidarity with you as a sister." And I'm like, "Oh, wow, thank you so much." And we were able to commiserate about how much dilating sucks. But, and she was a cis woman, right? And so the idea that and guess what? We both had to go through surgical care to get the vaginas that we wanted, and we were able to have a conversation about what that was like for us. So like the idea that like these surgeries, there's like a gold standard of like it has to be this one or your sex life is gonna suck is bullshit. And I don't know
Yeah.
where this freaking narrative is coming from. I hear this isn't the first time I've heard somebody make this argument before. It's just I don't know who thought it was a good idea to argue about the sexual pleasure of like trans women coming out of puberty. Like it's like it's really really fucking weird. It's really really
Yeah.
fucking weird. Yeah. Let people make private decisions about their private body parts and stop being like, "Did you have a
Yeah.
fully developed penis before you had that vagina? Because I want to know if you have good sex or not." It's like, "What?" Like,
And
what?
yeah, and allow doctors to have those options presented to the patients, because it's like, just because you don't like certain options doesn't mean that those options should be off the table for everybody. Like, maybe there's somebody who really needs that procedure, and it'd be really stupid and harmful to take options away just because you don't like them.
Yeah, yeah. It's
It's
just this weird workaround to trying to prevent preventative, or gender affirming care for minors. It's just
Yep.
some weird backdoor that they think that we're gonna be like, oh, you know what? That's right. Maybe we do want all the trans kids to have perfect sex lives. And it's like, you can have perfect sex lives without that though. Well, are you sure? Aren't you just getting a
Yeah.
prototype? It's like, I'm sure. I know many trans women that are having fucking bomb ass sex lives as porn stars. They're fine.
Yeah.
Right? Like it's like, and guess what?
And
They
yeah.
didn't go through male puberty to do it. Like, it's just like, oh my
And
God.
not to
So
mention,
frustrating.
like, I and a lot of people like me are ace and don't even give a shit in the first place.
Yeah.
It's like, it's
Yeah.
not even like, for me and a lot of other people, like, the sexual pleasure isn't the thing that we care about. So, and that's also
Yeah.
allowed. Like, it's okay to have different needs and wants with your transition. Like,
There's cis
yeah,
people that don't have a comfortable sex. They don't have comfortable sex, and they're born with the puberty of what they grew up as women, and they can't even have sex because they have different issues that they're having that they can't even have good sex. It's like, oh well, maybe we should have just put a neo vagina in that cis woman, and then maybe she would have been better off by having her biological one. Like there's like so many weird things that come out of the idea that we are trying to justify medical care by basis of sexual pleasure on who and what metric. Like it's just such a weird thing. Why are people so
yeah,
obsessed with
it's gross.
sex? Like, it's so weird. It's
Stay
like,
out
is
of
that what you're
yeah.
thinking? Yeah, I'm sorry.
Stay out of
I
my
had to get on
bedroom,
the
stay out of
sideline.
my doctor's appointments, just mind your own business on that.
Is mind your own business. Who
Mind your own business.
cares? Yeah, anyways, let's go into this
Alright.
week's poll real quick.
Yeah.
Oh, it's actually very split. We have 53% that said yes and 47% that said no.
Yeah, so I
Interesting.
picked this poll intentionally, because I know we are a trans show, but there's a lot of stuff going on in this country. It's an absolute shit show out there. And I actually, my response to this is no. Like, yes, trans people are very heavily targeted, but there are also groups of people that are actively being stolen from their homes. And so I think it's important to, yes, focus on trans rights and also be allies and activists for, especially right now, immigrant populations and BIPOC populations. Like, we need to become allies on that point as well, and not always get lost in our little bubble of trans issues. So
Yeah. Yeah. So great. Well, I also there I mean that's the beauty of this question. And like you said, it's just like there's like the Somali people, and then you also have like Latino communities as well. So there's a lot of arguments that could be made on a lot of ways. Like I was talking to a trans one of my trans friends today. She had a passport that had the correct gender markers. She went into the country and had her passport voided the second she stepped out of the airport. So they literally voided her passport until she gets a new one. It is wild out there. So there's like a lot of things that we could say about it. But yeah, good question.
yeah,
I'm excited to see how the rest of it goes. So yeah, you ready for the next call?
yeah, let's do it.
Okay. So we have B, she, it pronouns from Oregon, wants to talk about framing that conflates sex with gender. Hello, B. You're live on the line with Dr. Ben and Josie. How are you?
Hi, I'm doing pretty good.
Yeah. So tell us about it. What do you want to talk about?
So I've got this sort of thing stuck in my head. I don't know quite how to word it well, but a thing where it I've just had it stuck in my head, and I don't agree with it, but I'm having trouble finding ways to sort of reinforce its falseness, I guess. Um, and so the premise is just like sort of the way that buck and doe are terms for a male or female deer, for example, like man and woman, some might say could be used as the same way for humans.
Hmm.
And so I
So,
don't
yeah.
think
uh,
as just terms for male and female, but specifically for humans. And I don't see that talked about in that way much.
yeah. I'm sorry, I missed the first seconds of what you said about you said something about deer. Was that
Yeah,
I heard that
like
part. Yes, go ahead.
using man and woman sort of in the same way as buck or doe for deer.
Oh, I see. I see. So your question is don't do that, or is your question
Well,
in regards go ahead.
I don't think that's the right way of looking at things, but I don't know how to I guess justify that other than maybe just saying it's a different kind of category. But I don't. That almost doesn't
Yeah.
feel sufficient somehow.
Yeah, I hear what you're saying. I will say that a lot of times when we think about these type of questions, it becomes more like a pronoun debate, or it becomes kind of like the conflation of like, oh, we're it's such a inner community discussion. I feel like when you talk about to like, the general public, we talk about gender in the social construction of what we have in our society. So that would be man, woman, and non-binary. And that is kind of like a way that a lot of like the general public speaks on things. Now, once we start introducing the xenogender debate of like, doe and buck or whatever somebody chooses to identify with, it becomes complex very quickly because now you're talking about things that are outside of the social construction of what people know um generally to be what the general public believes to be the social construction of gender. And usually what I've come to understand about this conversation is when you're in community and somebody wants to be called doe or has that gender type of presentation or present or identity,
Well,
then
I'm
fine.
sorry, I'm not quite sure I made my point clearly.
Yeah.
I meant more like the way that people categorize a male deer as a buck or a female deer as a doe. It seems like people try to categorize a male human as a man and a female human as a woman. And
Oh, I see. I'm sorry. I misunderstood you.
that's all right.
I see what you're saying. I see what you're saying. So you're saying that because bucks and does are based on the sex of the actual animal of the deer, then therefore we
Right.
should do the same to human beings. I have a very simple answer to that. It's like the animals don't have a word that is delineative of the social construction of a doe like and a buck, and when it comes to gender, while humans are much more complex beings, that we have delineation because we have the words to be able to explain that type of thing. If you were to see a trans deer, right, like a doe that feels like a buck and acts like a buck and then is like going around doing the things that bucks do, if you go and tell that doe you're a doe, not a buck, stop acting like it, the doe isn't going to be like, oh, how dare you, How dare you not call me a buck? That's the difference, right? The difference is
Yeah.
that our observation and description of an animal is very different because you're not going to hurt the doe's feelings for calling it a doe because it acts like a buck. And so it just is. It just exists. And we don't have the language, we don't understand the language of deer. I don't know, maybe dolphins or maybe like orcas or maybe whales have some type of word for gender that we don't know in the culture of those animals. But outside of that,
Or
like
elephant.
it's yeah, or elephants. Maybe they do. Maybe they do have a word that is for gender and we just don't get it and we don't understand. But at the end of the day, we're not going to speak their language and tell them that, right? Like, and oh, maybe the transphobes will find a way. The transphobes will find a way to try to misgender the elephant if they had an opportunity to. But that's kind of how I look at it. Ben, what do you think?
I was just thinking, like, it'd be interesting to hear Erica's take on this, like as a primatologist, like if there are other primates that have kind of similar delineations between like sexual role and gender, and kind of what that looks like. But because I know there are animal species like with kind of gender divergent or like sex divergent behaviors. But I'm not
Oh,
an expert on that. But
I should
Yeah.
write that down and see if I can call when she's on.
Yeah, that would be good. Yeah, for sure. But yeah, like being these kind of conversations, like you could also throw it's like we call boats she. Like, is so, like, that's an amorphic thing. That what is there a sex to a boat that we're calling it a she, or are boats just gender coded? Like, I would also think about that as well if somebody tries to bring in some nonsense argument like we call bucks because they have dick and balls. It's just like, okay, where's the vagina on a boat then? Like, what's going on here? Like, so
Yeah.
I don't know. It just seems like it's a reach if they try to go that route, and if they are trying to go that route, I think you're winning the argument. But I don't know,
Yeah.
maybe I'm
So
being too glib
it
with it.
it seems like the answer to like where's like the difference is the involvement of the subject.
Yeah. Yeah, exactly. It's
Yeah.
always like that. Right? When and that's why when we have debates and conversations with human beings, like we always try to define the subject matter that we are speaking on, right? You don't want to conflate interspecies sexual characteristics with each other to then try to make an argument about gender because gender is not something that we've observed in the deer population. Right. It so
Yeah.
so so maybe we have, but it's not something that is going to be relevant to the fact that a person has gender dysphoria and wants to be the gender that they identify as is part of that conversation. And again, it just becomes a very silly conversation very quickly and it just starts to unravel.
Right.
Yeah. I hope that was helpful. I feel that was like very fast.
Yeah. Yeah. It answered what I was looking for.
Okay, awesome. Well, sorry for misunderstanding you at the beginning. I thought you were talking about construing somebody who has the gender or neo-gender of deer versus a person who has the human gender category of she. So I was just like I was
No,
just very I was very confused for a second. So I my apologies there.
that's all right. I've been sort of trying to go over and over how I would word this and having trouble with it anyway. So
No, I think I may have missed it, so probably on me. But all right, B. Well, do you have anything else?
I think that was all I was looking for. Thank you very much for your time.
Okay, awesome. Thank you so much. All right, have a great rest of your day. Bye.
You too.
All right. Make sure to like and subscribe. If you have not done so, make sure you do that. And also call in. The lines are still open. So if you would like to have a conversation, we've had some pretty good conversations, and I feel like we're pretty respectful. I know Dr. Ben, when it comes to medical stuff, has a shorter fuse, but I think even then we were fine. I'm not wrong. That's why you laugh.
You're not wrong. I just don't like when people armchair quarterback my job. It's wild how like people like when you're talking about, I don't know, there's certain disciplines that people just know they shouldn't try to be an expert in or pretend to be an expert in, but for some reason medicine is one of those
Politics.
that, yeah, like politics, but no, but like with medicine people are always like trying to think they know things. Like shut up.
Yeah.
Stop it.
Oh
I
my
didn't I
God.
didn't go to like
Never.
14 years of training like for someone else to tell me that they googled it better. Like, okay, you keep telling yourself that.
Yeah, I mean, like, don't ever be a politician because everybody's an expert with politics.
Everyone,
Everybody
yeah,
knows everything about politics. It's like
yeah,
it's the fucking worst. Like, it's like everybody has a freaking opinion on what politicians should do when it's just like just stay over there.
stop.
Like, it's fine.
Yeah,
It's like I've been dedicating my entire life to this craft. Please, please,
right,
please tell me why, after 2 years of like adult life and human experience, why your point of view is the correct one. Like, oh my God. Anyways,
right.
oh my God. Also, we have a competition. On the end of the show, we will call and we will read your super chats, $5 or more, and just put hashtag Dr. Ben or hashtag Josie, Team Josie, or Team Ben, and we will tally the points and have a little competition. So the positions that we would have to argue if we lose that competition is Polly is practical econ politics. That's just correct. Ally card requires monthly quizzes. Ooh, and force grass touching for TDS. Ooh, I like that.
And
I
because
Yeah.
like
people in
the
the chat don't understand, TDS does not mean Trump derangement syndrome. No, no, no. The conservative
It's trans.
anti-trans lunacy has changed its meaning. It now means trans derangement syndrome. So if you
Ooh.
are one of those people who is like so mentally ill about trans people that you bring them up in normal conversation, like you're going to get put on a leash and forced to touch grass by the state or something. I mean, I don't want to make your argument for you. Also,
I mean, I
whoever,
mean,
I was like, some of them probably want to be led around by a leash. Let's be real.
that's true. If anyone remembers what Josie was supposed to defend last week before she left and abandoned the show,
did I lose? Did I
you did lose. Oh yeah.
Oh no.
Please remind us what the
I mean, but
what
can
the
I
thing
really
was.
trust you, Arden? Like, honestly,
Oh, the chat will
like,
come through and back me on that. You got slapped around on on those
it's not
votes.
my fault. The fire alarm went off, and I had to like literally leave the show. It was just a bad timing. It was just a bad timing.
Also, we still have open lines and there's more time, so call in people. Yeah.
Yep.
Yeah, it's just people are just scared of the heat. There's a scared of the spice. If you aren't scared of the spice, call in 720-619-2288 or use the web link in the browser. Do it. Do it now. We are kind and we'll do our best to take you in good faith. Or we'll match your energy. Just get ready for the spice either way. Great. So we will go ahead and take Bill, he, him pronouns from Illinois. You are live on the line with Dr. Ben and Josie. How are you?
Good. Hey, Doc. Hey, Josie.
Good.
How are you?
What's up?
Doing well. So tell us about it. You were talking about pronoun usage.
Yeah. So one of my friend's siblings came out as non-binary and wants to use they, them pronouns. And I've called in about this before, and I actually called in 2 weeks ago to ask about this. And then I had to leave. So I've been doing some text to speech stuff, and
Mhm.
I found that
when referring to myself, I don't mind anything else, besides he, him, but I don't want it used because I don't think that's as accurate. Does that make sense? I feel like I'm rambling.
I'm not. I lost me with the voice to chat thing. What do you
Oh,
mean when
oh,
you're
oh,
saying?
I'm sorry.
Yeah, it's okay.
Uh, my friend's siblings came out as non-binary and wants to use they, them. And I still don't
Mm-hmm.
have a good grasp on what would make someone feel that way, you dig? Uh,
Mm-hmm.
so
Yeah.
I wrote a little description describing myself, and then I switched out the pronouns and had a voice to text me, read it about me to see if I could get a better grasp on it. Does that make sense so far?
Yeah,
Yeah, yeah.
it
So to
does.
summarize, you were trying to see how you felt when different pronouns were used about you, and you found that you didn't care as like you didn't feel any specific way for those different pronouns, but you still want to use the most accurate ones for yourself. Am I getting that correct?
Hole in one.
Okay,
Okay.
great.
Okay.
No,
Okay, so
I
what
do
is that
appreciate.
called?
When you don't have a preference for a gender or a pronoun being used on yourself.
Well, that's the thing. So, and I'm sorry if I'm not being clear because I'm real confused
No, it's
myself.
fine.
Mhm.
No, it's fine. We get these calls all the time. Go ahead.
So, like, if someone said, "Hey, look at that fella over there with the long nose hairs," it would kind of be like, "Well, I mean, that's accurate, but that's really not the most notable thing about me." Similarly, if someone said, uh, "That fella over there with the they them who looks like Ryan Gosling and George Clooney had a kid," it's like, well, you could use they them, but that's not as immediately distinguishable.
Uh-huh. Okay. So, so I just want to make sure that I'm tracking. So, if I were to say, "Hey, look at that girl with the short haircut and the button-up shirt," and referring to you, what would that arise out of you?
Uh, I would object just because I don't think it would be clear to a third party. Or
But what
or I
about
don't
you
think
though?
that when people
What if
say
it was only
girl, they
you?
would pick.
Okay, go ahead. Sorry, I didn't interrupted. Go ahead.
No, no, apologies for me interrupting. Uh,
No, that's fine.
I would object because I do not think that looking at me, girl would come to mind, and so that wouldn't be the most accurate.
But what
See,
if
this
But
but what if
is
like,
but and I'll let you talk in a second, Dr. But but what if it's like your back is turned and they just for some reason just got a feminine vibe off you for some reason and they were just like, "Hey, that woman over there with the button-up shirt, that has her back turned to us with that haircut." Like, and they could identify you. They say, "Oh, it's the red shirt over there." Like, how would that make you feel? Regardless of
it would kind of be
accuracy.
funny, but like I wouldn't be upset by it or nothing.
Okay. Yeah, that's what I'm interrogating. Go ahead, Dr. Ben, you wanted to say
yeah,
something.
I just wanted to point out that this is like an odd example in that like I think because of the fact that we're allowing ourselves to self-identify more authentically with who we are as people, I think a lot of us are even moving away from using like gendered terms to identify somebody that we don't know their gender. So like if there's somebody out in public and you're pointing at them, I think a lot more of us are going to say, look at that person with here are these more specific characteristics here. I think that relying on the utility of someone's assumed gender isn't as appropriate anymore now that we understand more about gender identity and how those assumptions can be wrong. So I think maybe we need to go in a slightly different direction and say You know, just how do you feel if someone were using pronouns to describe you? How would you feel, as opposed to like uh, going off of those assumptions or like the utility of those assumptions?
I'm sorry, I don't understand the question.
No, no, I get what I get. So essentially, so I'm gonna take a step back. I'm gonna rewind a little bit here. So
Oh, I'm
in
sorry,
the chat,
Josie.
uh-huh. Go ahead.
I just want to make it clear, a pinky promise. I'm asking all of this in good faith.
Oh, I know you are. I know you
Mm.
are. No, no, no. That's never been my thought in this conversation at all. I know you're fine. You're great. And
Yeah.
this is actually good because the chat is actually very curious about this too.
I'm fine as
One of the
hell.
things, yeah, yeah, there you go. So let's take a step back. So in your chat it says you want to know how someone knows to use they them for themselves. Is that the root of what you're asking? Because we started the conversation about yourself and your own personal identity of they them. Is the question more clear about like when somebody comes to the realization that they're non-binary and want to use they them pronouns? Is that where you're coming from? And this kind of question has sparked something inside of you?
Yeah, because my friend's uh, sibling. Uh, I'm sorry, I'm being hesitant because I don't want to
Yeah,
be rude or nothing.
Yeah.
yeah.
Uh, to me,
Sibling's
if
fine.
I thought I was non-binary, I would just use whatever pronouns people were describing me with, because that seems to be the position of, well, this doesn't really matter. So I don't
Yeah,
understand.
that's different. That's not non-binary,
Mhm.
that's agender. Right. Like the idea. So it's funny. This I've been on an agender kick on the show lately. It's come up I think 3 times since I've been on. The idea about agender is essentially having no sense of gender. So therefore, anybody that refers you to any gender doesn't really affect you because it's not even in the concept of understanding of what a gender identity even is. So that would be something that somebody could have, or somebody could just have an apathetic view of pronoun usage because they just have no care about what gender identity is either. So there's like, but non-binary is something specific. It is something that is outside of the two social constructed genders of man and woman. And so therefore they fall either somewhere outside, inside, around, whatever that spectrum looks like is a very specific thing, because a non-binary person would, and I know a lot of non-binary people, I work in trans equality across the country. There's a lot of non-binary people, regardless if you gender them in the opposite gender, or I'm not opposite gender, but like regardless if it's he or she, they're going to take offense regardless of what it is, because that's not who they are. They don't identify with that gender, so therefore they could take offense because they're non-binary. They have a specific set of pronouns and it's they them, and that's what they want. But to be apathetic is a completely different type of gender identity, completely, or no gender identity at all. Does that make sense, Bill?
I understand the words you're saying, but it doesn't
Hmm.
really click for me. But I suspect that's
That's
a
that.
me issue.
Yeah.
Uh,
No. It's fine. Can I ask you a question, Bill? I'm going to ask you. Um, what do you identify as a gender for yourself? Man, woman,
I would say
person?
man, but with
Okay.
all that's changing
But
recently, who knows anymore? I'm just
so
being goofy.
no, I'm serious. This person would never say that. But I'll just say that I'll ask you, and I usually ask this tongue in cheek, but I'm going to ask you in actual all seriousness. Why do you feel like why are you a man? Why do you identify as a man?
Well, because that's what everyone else says. And isn't that the purpose? Like just an
No.
arbitrary
No, no,
demarcation?
no, 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 not at all.
No,
No.
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 Gender is not gender is something you internalize as an identity. No one else can give you a gender, Bill. Your gender
I
is
thought
your
there was just
own.
a oh,
Go ahead, please.
sorry. I thought it was just kind of like or the way I've been envisioning a lot of this gender talk is by relating it to hair color. You know, someone may be a redhead or a blonde or whatnot, but that's just descriptive.
Yeah, so Bill,
Yeah.
we're striking some foundational beliefs here, and so I'm gonna tread as carefully as I can because I don't want to assume things about you. So please forgive me if or stop me if I'm going into something that is too sensitive, for
Oh,
you as
please.
a person. Yeah. So
Oh, no, no, I meant, oh, please, as in, no, no,
oh, I
I'm sure
know,
you're
I
acting
know.
in good
I
faith here.
No, 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 it's fine, Bill. I think this is a great conversation because I think this is a great learning experience for everybody. Um, Gender is something that is not like things that people give you. Gender is something that you inherently have. It's something that you have inside of you. Now, some people have no concept of gender, which is an agender thing. So the idea of not understanding why so and so has a gender or why somebody cares if their gender is said a certain way may not have a concept of gender themselves, so therefore, it may be a case of fact that you may be agender yourself, and I want you to explore that. I'm not saying you are. I want to say that I cannot tell you what you are. Only you can say who you are. But there is a possibility that agender is something that you have inside of you, which is the no concept of gender at all. So you've been going through the world saying you're a man because that's what everybody around you told you you are. But either way, it doesn't matter for you because you have no actual sense of gender or an idea that you may not. I'm not saying you don't have a sense of gender. I'm saying you may not have a sense of gender. What are your thoughts?
Oh, I'm sorry. I thought you were going to go on.
No, no.
Okay.
I want to hear your thoughts about that. Have you ever thought about that concept?
Uh, w- let's say, for the sake of argument, I didn't have a sense of gender. What does a sense of gender feel like?
Haha, that's what that's so
Yeah.
there you go. There you a sense of gender is if I called you a woman right now, Bill, you'd be like, "What? I'm not a woman. I'm a man." Right? Like that a sense of gender
No, my
is if it is something that you have, something nobody could take away from you, right? It's something that's internal to who you are. That's what an agender, I guess, in just the use your words, feels like. It's what you have, right? Like, let's say, what's your favorite ice cream color, flavor?
Rocky Road.
Okay, Rocky Road. All right.
Right.
So it's nobody could take that away from you, correct?
For the purposes of this conversation, no.
Well, okay. So your favorite flavor of ice cream is Rocky Road, and there's
Yes.
no way I can prove that you're not lying to me. It is your internal identity of that my favorite ice cream is Rocky Road, and that is very
Yes.
solid, right? You said that confidently. You identify it as a Rocky Road lover and enjoyer. That is what you identified as, right? So it's very similar with the sense of gender. Like you either are what gender you declare, which is man, woman, non binary, or whatever people feel like their gender is. That is a declarative, that's what I am. Just like you declared to me that your favorite flavor is Rocky Road. You don't know why your favorite flavor is Rocky Road, it just is.
I mean, I'm a huge texture eater. I'm sorry, I'm getting off topic.
No, it's
Uh,
fine, but you know what I mean.
mm, I kind of want to say no because gender's just descriptive.
No, gender is a thing that you have. It's internal. It's not descriptive. Gender expression is a descriptor of someone, how someone expresses their gender, but that's femininity, masculinity, right? That's more descriptive because you can actually look at somebody and say they're more masculine or they're more feminine or they're neither or both. That's descriptive. That has nothing to do with gender. That's just presentation. Gender is an internal sense of who you are.
Wait, uh, uh, I'm not saying that you're wrong here. I thought how it worked was like a kind of a sliding scale of masculinity to femininity, and at a certain point of masculinity, we just call you a man, and at a certain point of femininity, we call you a woman, and in between, there's
No,
some leeway.
no. So
No,
the
all right.
identity, no. So the identity is something that is going to be persistent with yourself and your sense of yourself. And that is something that Josie is talking about that will never be taken away from you. That just is. Right. What you're talking about, I think, is how we categorize expression and roles and that kind of thing on a societal level, which that can be on kind of a spectrum. And of course, your identity can be on various different points, like man, woman, non-binary, agender, like Josie was saying. But you yourself, the identity that you have is going to be what it is.
Yeah.
What you do with that identity, like how you express that, how you integrate with the society around you based on societal expectations of that gender, that is going to be a bit more gray on a lot of that scale. So, but even if you fall different places on masculinity or femininity, as you can identify as a man and express yourself very feminine, and it doesn't take away that you're a man, right?
Yeah.
And you
So
can have any different combination of that. So just don't conflate the gender identity and the uh, like gender expression and the interacting with society part, because those are separate concepts.
All right. Well, you're the expert here.
well, Bill,
Uh,
and it's not just for you to accept what we're saying. It's like the idea. I'm sure you've met masculine women. And masculine women probably are like, "Don't call me a man," right? Like because they're masculine women and they want to they identify as women. They take pride in the fact that they're women in a masculine way. You wouldn't take that away from them and call them a man just because they present masculine. You see what I mean?
no, I'm sorry. I can't picture what a masculine woman would look like.
Like a butch lesbian.
Yeah.
I thought they were just called butch.
They're women. That's what they are. They're masculine presenting women. Butch is the masculinity part.
Oh, I
Yeah, and
thought that was
that's
just a
something.
style.
No, no, it is style, a very masculine one. But they are women that are butch
Yeah, yeah,
women.
Bill, this is something that when I was learning about my gender identity and going through that whole process, I had to wrestle with myself on, am I not a woman, or am I just a more masculine woman like we're talking about? Like, and that was something initially difficult to kind of tease out. But once I met people who were very confidently tomboys, I guess is how a lot of people call them, or butch people, they are very proud to be women. And they're even, I believe there's a documentary I was watching at one point that was about women and different types of women being allies for each other. And there were very outspoken butch women that were there saying, yeah, this is how I look, this is how I act. I am very, very proud to be a woman. And I was not that. I learned that, you know, I I was trying to make myself happy with the idea of being a butch woman, but that was not me and it was never going to be me. So there's a clear difference in that identity. And in fact, if we think about the way different gendered terms make you feel, like if you have on a spectrum from euphoria being this gives me absolute joy to have this happen to me, or dysphoria being this is absolutely terrible to happen to me, like I could be doing the exact same thing, wear this exact same clothes, have the exact same hairstyle, but to think about myself in that way as a woman, like with the label of woman, that was absolutely dysphoric for me, as opposed to, again, same clothes, same hair with a different label without the label woman, and it felt neutral or euphoric. So that label does carry a weight for people who have a sense of gender identity. So if you don't have that strong of a feeling, that's totally okay. There are people, a lot of people that do have very, very strong sense of self with regard to those labels.
Okay, learning a lot today. Oh, hey, quick aside before I forget, and excuse me if this is rude. Is butch one of those terms you're not supposed to use unless you are one?
No, no,
No,
you
you
can
can
use
use it.
butch.
Okay.
Yeah, butch is
All
good.
right. Well,
Yeah,
I mean, I come
it's the
from a
one that
long
starts
line
with
of
the
people
letter.
who
It's the one that starts with the letter D is the one you're not supposed to,
okay. All right.
and
Well, I
rhymes
come
with
from a long
bike.
line of people who
Yeah.
weren't nice folk.
Yeah, yeah, exactly. So, Bill, like, I really appreciate the conversation. I want you to think about it deeply because I want to say this, it's okay to not have an understanding of gender because you just don't have a concept because you may not have a gender. You're just like completely just like, I don't know, I don't understand. Just like people who are ace and are you familiar with the term ace, Bill?
That's uh asexual, right?
Yes, exactly. So there's a lot of people in the world that are ace that have no desire to have sexual intimacy. And
That's me.
arrow would be, yeah, there you go. I didn't mean to be speaking for you, but like maybe you can explain for the audience. And I don't want to put you on the spot, Doctor Ben, but you know, you may not understand the concept of sex, but you know it exists. But for you, it's just like, right? Am I wrong?
Yeah, yeah, no, it's a thing where I spent a lot of time trying to figure out what my sexuality was, and a lot of it was that I felt like I needed to have partnership, or that it was expected that I like certain things or don't, and I don't have those feelings for partners. Like I do engage in uh kind of spicy activities by myself, and I like that by myself, but I have zero desire, or very, very low desire at best, like for another partner to be part of that. So and yeah, it took a lot of like feeling okay with not having to meet whatever expectations somebody else had, of because it just seemed like sexuality was something that there's a life stage that you have these feelings and you go have these experiences, and it felt like I had to do that, and then allowing myself to not have to feel pressured into doing that just because somebody else wants it or because somebody else expects it was really freeing for me. And I don't know if that might be analogous to what you're feeling with gender, maybe not having to have those expectations, and just being authentically yourself and not having to worry about it. Maybe that'll be liberating for you to think about.
Yeah, which is
Okay.
okay to be.
Can I compare this against something?
Sure, please.
Yeah.
Have you ever seen Star Trek: The Next Generation?
I've seen a few episodes.
All right. Oh, there's
Go
an
ahead.
android character, Data, on there.
Oh yeah, I know
Yeah.
Data.
Yeah, yeah.
Okay, so would Data be a gender?
Yeah, I would believe so.
Mhm.
I'm not too familiar with the character, but I would think Data would absolutely probably be agender because it's like the concept of gender isn't necessarily important to Data. Like
Hmm.
Data isn't going around saying I'm a man, right? Like that's not the concept, right? I may be wrong. Maybe wrong. Now I want to look up, is there like a headcanon where Data's agender? I would like to I would yeah, I that might be the case. I'm not sure. Yeah, I
Well,
think
there was one where he
people in the
constructs a
chat are saying,
child and
yeah.
he lets.
Go ahead.
No, I'm getting off topic. I was just saying there was an episode where he constructed a child and let the child chose its gender and look and species and all that. Kind of interesting.
Mhm.
Wasn't one of the best ones, but it
Yeah.
was all right.
Yeah. So
Interesting.
so so yeah, so yeah, it's a very interesting it's an interesting point of view. But Bill, think about it. I would go on and look up agender and try to figure out some of the experiences that people who identify as agender have. Because they may have a very, very similar concept to the way that you feel about why people get so bent around the axle about gender. Right, and, where it's like, "Why does it matter so much?" Like, it's like, "You're they, them, alright, who cares?" Right? Like, it's like, that may not be mean, that you may not be saying that in a mean way, you just may not understand why somebody doesn't wanna be identified as man or woman and non-binary because that's an actual gender identity, and if somebody isn't respected in that gender identity, you are hurting their own, identity of gender that they have. And so,
Well, I mean,
like,
I
in
wouldn't want to
your
hurt
life,
anyone's feelings.
exactly, right? But
Oh,
you don't understand that concept, but the fact is it may be because you just you don't have an analogous experience about your own gender because you may not have one.
okay. Or
Yeah.
I'm sorry if it seemed like I was interrupting. I was just going to clarify. I
No,
wasn't
you're
being
fine.
sarcastic with that
Yeah,
remark.
go ahead. No, I know. I get
I'm
it.
told I have issues with tone.
It's fine.
Great. Well, I'll look up that term. Is there anything any other homework I should have?
No, I think that's pretty good. Dr. Ben, you have any ideas?
Yeah, I mean, just play around with it. Like your gender identity is for you to explore and find out more about who you are. It's okay to try stuff out. It's okay to try out different pronouns. It's okay to do all that stuff. Have fun with it.
Yeah,
I don't
definitely.
understand what that means in this context. Play around with it.
Yeah,
Yeah,
see
just
what
like
I see,
yeah, yeah. So
it's
that
not
might give you some
connected. See,
answers.
well, that's the thing that Dr. Ben, it's like, what is playing around with gender if you don't have a concept of gender?
Yep.
You see what I mean? Like, it's like
Well,
it
no,
is a
yeah, and
very
that was my thought
complex
is that
thing.
like, yeah, no, and that was my thought. Like, if you land on a gender, or like if you keep doing things and you still get kind of no response from it, then that kind of might reinforce that you're more agender. But if you do try something and no, actually you do have a response to something, then maybe that'll change your perspective on it. So I don't know. Like it's just it. I don't know. Like
You
you
can't
might
explain
find
gender euphoria to somebody who doesn't have a concept of gender, Dr. Ben. Like, it's
Well,
just
no,
like,
I'm saying that we're not at 100% sure that this is the case.
well,
I'm just
I'm
saying
just
that there's a
saying.
possibility that they just haven't tried something that does click with them. So I was just saying that like there's
You
lots
know
of
what that you
possibilities.
know what that you know what that sounds like, Dr. Britton. Maybe you just need to have that great intimate experience with somebody, and
That's not what
maybe.
I'm saying.
Oh no.
That's not at all what I'm saying.
I know.
I'm saying
I'm
like
being mean.
yeah.
Okay.
No, Bill, you don't
That's that it's
One
understand.
okay
last
to try
clarifying
things.
question. Oh,
Yeah.
Go ahead, Bill. I'm just having a good time with
all
Dr.
right.
Ben. I like teasing him. Go ahead.
Well, it's just so easy. Nah, I'm just giving you
Yeah.
feedback. Uh,
Yeah.
one last clarifying question, and then that's it for me. I appreciate your time and all that. Okay, so if I
Yeah.
were to wear or continue to wear my masculine fine clothing, uh, and enjoy that, I might be a man. And if I were to wear like dresses and skirts and whatnot, that would be a woman. What euphoric experience would you expect from a non-binary?
Um, not presenting like I'm not non-binary, so it's hard for me to
Yeah.
say.
And you
I
might not have euphoric experiences even in any of these. It might be a neutral versus dysphoria position as well. So
yeah. So yeah, it's just being able to live your truth without having to live in the social construction or social roles of what is in the social construction of man and woman, just like it is for me when I live in the social construction of woman for me. So that it's essentially that. It's just that's how I would assume it. But again, I'm not non-binary, so it's hard to say. All right.
Okay, well,
Well, thank
I
you, Bill.
appreciate you
I appreciate you.
taking the time to talk to
yeah,
me through all this.
Yeah, absolutely.
I'll do some research.
Yeah, good luck. All right. Talk to
All
you
right.
later.
Oh, thank you,
Bye-bye.
Josie. Thank you, Doc. Bye.
yeah.
Bye.
Thanks for your call.
Oh my gosh. I'm seriously having a lot of conversations with folks about agender because like
Yeah.
I think this channel attracts a lot of people that have genuine questions about why does it matter so much?
Hmm.
Right? And I think that some people are in bad faith. I think Bill was in incredibly great faith. And I think that I've had conversations with people who are bad faith trying to pretend to not be agender or try to pretend to not understand gender. But the
Hmm.
second I start talking about them being agender, their troll face washes off and they're like, no, I'm a man, blah, blah, blah. Because
Yeah.
once you start making them sound woke, right? Which is like,
Yeah.
oh, you don't understand gender because you're probably agender. And the second you do that, a troll, somebody who refuses to understand for the sake of refusing to understand, immediately breaks the programming and it goes back. But there's been a lot of calls that I think we've had where folks genuinely are embracing the understanding that, hey, maybe that's the thing, right? Maybe that's
Yeah.
the reason why I'm so obsessed with trying to understand something that doesn't exist in their own s-
Hmm.
individual self. And I think that is
Yeah.
something that we need to really be a very open to for a lot of folks who may fall into, and like on the transphobic side of people who are just like not caring about gender because their own sense of gender is just not there. And I think it's probably more common than we think it is. I don't know. That's
Hmm.
my own. I'm
No, I
I
agree
don't
with
have
you.
the
I
yeah.
agree with you on that. I
Yeah.
think
It's just
especially in a society that is so enforcing of a strict binary, where you're told everything has to be one or the other, I think it takes a lot for people to warm up to the idea that, hey, this doesn't have to be an expectation, that there are people that don't have to align with any of it.
yeah.
And yeah, I
Yeah.
think we need to support that more.
Yeah, I agree. I agree.
Hey,
Great.
before we
So,
take the next
yes.
call, I'm probably going to close lines here. I want to remind people that they can send super chats of $5 or more, and we will read them out live, and you can add your vote to our little challenge. Also, if you hit like and subscribe on the video, it's totally free and helps us massively on our place in the algorithm. Also gets us a chance to be in front of more
Yes.
potentially oppositional callers. So please go ahead and give the video a like if you are having a fun day, fun stream. Thank you.
Yeah.
Yeah. Thank you so much. The voice of God.
I
Yeah,
always knew God was a woman.
yeah, I mean, yeah, of
Yeah.
course. It's obvious. No, but to deny the existence of the God that was just talking will hurt us. So we have to believe in her, or she will rig votes
Yeah.
and kick us off the air. Like it's very real.
Yeah, she is a tyrant a little bit.
Yeah.
I
Um,
will smite you.
See, there it is.
oh
I
yeah, no,
told
the other
you.
thing too, if we make her mad, she'll just start playing pink
The pink
trombone in the
trombone.
background.
Yeah, yeah. She will
That's what
absolutely
really
do that.
happens.
Yeah. Great. So let's
Okay.
just go down the list here.
Yeah,
So
let's do
let's
it.
talk to Tyler, he, him from Texas. You are live on the line with Dr. Ben and Josie. How are you?
I'm good. Can y'all hear me?
Yes, can hear you great.
Yep.
Okay, that's good. Well, like I told the call screener, I'm more trying to figure out how to bring the subject of transgender people up to my daughter when she gets of like an age where she could properly understand it. Because I know everybody's experience is different. Like I believe, Josie, I believe your experience is probably different from Arden's and then the next person and so on. So I want to get like an understanding of how to bring it up to her and say, these are just people being themselves. There's nothing wrong with it, and they have every right to exist and be who they are.
And how old is your daughter, if you don't mind me asking?
Right now she's 8, and I know that's kind of real soon to be, getting information about that, I think, but she catches on to things like really quick and really easily. But I wanted to have some kind of, I guess, preparation or just some kind of thing in mind to just help me smoothly talk about it with her.
Yeah. The reason I ask is because there's a lot of material that exists at all ages, right? When they're young and you're still reading to them every night, there are books that are age appropriate about like the crayon that was in a blue wrapper but is actually the color red, right? And it's like you're a blue crayon. It's like actually no. It's like and everybody is getting mad at the crayon, right? Because they're not the right color that they said on their label. But then after they're like, you don't have to be a blue crayon. It's like you can actually be something different. And so it is that's age appropriate for like 5, 6 year old. But for an 8 year old, maybe like there are things like that you could maybe be interested in communicating with. But at the like if you are raising your child to be inclusive and loving to all people, I think that being a good parent and being like, "Hey, did you know that there are people who consider themselves trans? Oh, have you met anybody who's trans?" I think like it's very similar to like when you're teaching your child about their own body parts, for example, when they're young. Like you're able to use anatomical language about, what they have and being able to have the conversation of like, some people are trans and this is what trans is. And like that may be the place to start. And then I don't think you need to go as far as like, if you're a trans person, I'll still love you. Maybe if that's what you want to do, you could say that too. But if you are very open and honest and you are just educational, I think you will equip your child in a very good way when the situation arises where they are interacting with a trans person. I know because I was born in rural Texas, for example. I didn't get that education. Now I still came out as a trans person. This is me personally as a trans person saying this, but there's a lot of people in my life that also grew up in Texas that weren't equipped to have a friend that is trans. And they asked a lot of weird questions and a lot of things that were just not the things that you would think about asking a human being. But if I knew and they knew trans people existed at a young age, it would have just been a thing that I did. So there's a lot of value in having that be taught to your child in a way that is, in your hands, just to tell people that, people are born all different ways. Dr. Ben, do you have any thoughts?
Yeah, I think like even early on, just kind of reinforcing the idea that your body doesn't control who you are as a person. And so kind of teaching that from an early age, getting them to understand that their identity isn't controlled by these external factors. So like whatever your body looks like, that doesn't mean you have to act a certain way. or think of yourself in a certain way. And so I know the crayon story kind of uh, gives that idea a little bit, but um, stuff stuff like that. I'm sure there, like Josie said, there are some resources out there probably that have like really good analogies on that and like how to introduce some of those kind of concepts. Um, and then I think like timing it out, especially for if there's a time in this child's life where they meet somebody who is trans or meet somebody who is on the LGBTQ spectrum, that you can have those conversations about like a real life example, of course, with somebody that would be comfortable sharing that information, and that you'd be able to kind of talk about that. But I think contextualizing it for the kid, as far as like they understand that they can be authentically who they are, and that whatever somebody else wants to tell them they are isn't always true.
Okay, that does help because me and her mom, we're not together, but we have discussed it. Like her mom's opened up recently that she identifies, I believe, as non-binary, and then I identify as being bi. But I want to be able to let her know that there are people in the LGBT community, and there's nothing wrong with them because I was raised Catholic, and that whole, this isn't right, this shouldn't be the way it is. And, 'cause eventually I got away from that, and I'm like, well, what does it matter? If two people care about each other, at the end of the day, it's not hurt anybody. So what does it really matter what everybody else thinks of them? So, and she already like is accepting of other people. I just want her to realize, that, like I said, that there's nothing wrong with any of this. They're happy. Their life doesn't affect yours at all, So if they're happy, you're happy, and all that, it shouldn't matter.
Yeah.
Yeah, and you'll be surprised. Like I remember, so when I first was coming out as trans, I was dating a person that had a 6-year-old kid, and I was with that person for over 2 years. So I was like a parental figure for that child. And as I was coming out, I came out to him, and I was like, "Oh, by the way, this thing is happening." I was just honest. And he literally looked at me and he's like, "Okay, can we play Legos?" Like, it was literally that. Like, that's exactly what happened. And it's like, kids are taught hate, right? Most kids are very just like, all right, cool. Like, can I have my favorite food tonight to eat? Like, that's the way kids are. They're very sweet in that way. And you'll be surprised if like you have this conversation. You're like, "Yes, I know." Right? "Yes, I know. I already know that it's okay." Like, and it's like, because I think that as adults and as parents, we kind of like catastrophize things in our head of like, "Oh no, I wanna make sure that my kid is accepting." But if you raise your kid in a happy household that is educational and understanding of empathy and love, your kid will turn out all right. And you just got to be able to be there for them and let them, and to guide them on the path of love and acceptance. And so I think that you're asking the right questions, and I think that it's never too late or too early, in my opinion, to tell a kid that different type of humans exist. And so I think you're already set up for success in your household, it sounds like.
All right.
Yeah.
I, like I said, I mainly wanted to ask because the only trans person I ever met, I only worked with them briefly, and now they're somewhere in Texas. I don't know. But no, I do really appreciate both of you talking to me and just like helping talk me through this. So I have like a better understanding or like a much better approach at doing this, and that I'm not overthinking all this, you know?
Yeah,
Yeah.
no problem.
Yeah. Yeah, I appreciate you. Just keep being the great parent you are. And the kids are all right. And just make sure that they have the ability to know that it's okay to be whoever you want, just be nice and kind to each other is the most important thing. And the things that are scary are the parents that are teaching hate. Right. There are a lot of people out there that are teaching their kids to hate one another. And it's a very, very sad and scary thing. But
I
yeah,
know it is. I'm sorry, but yeah, it is unfortunate, but yeah, I do my best to teach her that you can love anybody that you want, and that it's not gonna help you at all just by being mean and isolating yourself from everybody else.
yeah, yeah, absolutely. Well, much love to you, Tyler. Keep being the great Papa Bear you are. And I think everything will be great. Good
All right,
luck.
thank you, Josie. Thank you, Dr.
And
Ben.
and you
Hope you
and
have a
and
wonderful
and,
day.
and call us and tell us how it went. I think it would be very informative.
Yeah.
Once you have that conversation, I would love that. Okay.
Mhm.
All right, I definitely will. Thank both of y'all again.
Awesome. Thank you. Bye bye.
Bye.
All right.
I have
Is that
thoughts.
it?
Can I share?
You have
Yeah.
thoughts?
So
Yeah,
Yeah.
go
we
ahead.
had one more open line with a really interesting call that was about like whether or not gender
Yeah.
is objective, kind of. And I
Mhm.
wish they had stayed on the line because we were going to get to them, but I guess they couldn't wait. I do have a line open. Whether or not we use it, what I think we should do though is Josie, you have to do your 2-minute defense of last week's topic.
Yeah.
And then if nobody calls, we'll just go to super chats and we'll do this week's. But I think what you should do in the meantime, in case give someone a moment to call in, is do your
Eh,
2-minute defense of last week's
The
topic.
ballots were stuffed. The ballots were stuffed.
I
Like
mean,
I deny the results of this election. Is
this
is
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 this is what you're
is
getting in Montgomery County Council is another election. No, just kidding. So the winning topic was gender by Coliseum duels.
Ooh, wait. Oh man. Okay, give me a second to think about that. Let me
Yeah.
see. Gender by Coliseum duels. Oh man, I have to have a clarifying question.
Okay.
Does the gender are you fighting for a specific gender, or is the person get to choose after they win their gender? And does the loser of that gender lose gender altogether?
You know what? I think it's your call. You're the one who has to
Oh
defend the
gosh,
position. So I think
it's
That's how
too
agenders
much.
are born. They lose
This
the
is I'm saying lose
yeah.
the Coliseum battle, and that is it. Or does you know what? The person gets to steal the gender of the loser. I think that's the way it should be going.
All right, all right.
Put some skin
Don't
in the game.
don't spill your thing before we get all right, all right. Let's get your arena up. Are you ready to defend your position, Josie?
Yeah, I am. Let's
All right,
go.
here we go. Charge up that clock in 3, 2, 1, go.
I think gender by Coliseum duel is an incredibly important thing to be able to do. And look, I know some of you baby like, all right, well, if you're already assigned sex at birth and you're given a gender, you have an opportunity. So trans people, start lifting weights, start getting your dueling on, go to some jiu-jitsu classes, learn a nice skill like sword fighting or axe throwing, because this is your chance to steal the gender of the people you do not like. Oh, you that kid over there messing with you? Well, challenge them to a Coliseum battle and take their gender forever. This is the way that trans people should be born, through the blood and sweat and tears of your enemies. This is how it should be, and no one has the opportunity to take your gender away once it's won in fair combat. So you wanna you looking at somebody, you're like, oh, you think that I'm not I'm a man? Okay, great. challenge me for it. Let's make that happen. And then boom, you're in a coliseum, screaming crowds everywhere, witnesses to show how bad you want it. Take that gender from that other person, and then that other person has to lose their gender rights altogether because they're the ones that search your honor. They're the ones that said that you are a man when you're really a woman. So take it from them, to let them know how it feels to not know who you really want to be. So sharpen those swords. Make sure you're ready to get those axes thrown. Get your net game up. Get a net like in the old gladiator battles. Maybe train a tiger. The sky's the limit. It's your Coliseum battle. How bad do you want your gender? This is the way to go. All right. So that is why gender should be won by Coliseum duels.
Beautiful. Thank you.
Yes.
Well, we don't have any callers, so I guess we're gonna move on to super chats for now.
All right.
We might end up ending. Well, we have to end at 5, so I'm hoping we can stretch these out where we don't have nearly enough super chats to get us to the mark yet. But I'm gonna close lines.
Get your super chats in.
We can chat and hang out and vamp if we need to.
Yeah. So Dr. Ben, do you know that the audience has been playing bingo? Like we're some hamsters on a wheel. Like that's what we are. Are you entertained, chat? Are you entertained?
It should be, because we do this for you in the side chat. We do this so you can have fun while we have frustrating discussions.
Yes, no, it's good. Like Dr. Ben, like they have like emotes of us in the chat. Like I had there is one called a Lozy, like LOL SSIE of me laughing. And which is laugh my ass off OZ2. So a Lamozy.
Wow.
These diabolical, they're diabolical, which I love. It's fine. But it is good. It is good. I'm just saying.
While we're vamping for a minute, I do want to shill some things. I've had some people from the side chat here joining me for my trivia nights on Fridays at 9:30 p.m. Eastern time. And we are doing that this week. So I know Sapphic Hazard is usually there. Fuzzy Logic is usually there. It's open to anybody. I can fit a lot of people in the Kahoot game. So if you want to play some virtual pub trivia with us tomorrow night, join me in the side chat.
And you don't need a Patreon for this?
No, I mean it's just my weekly.
Wow,
gaming
does Jimmy
stream,
know?
so.
Does Jimmy know that you are snaking perfectly good content that could be paywalled by
It could
Patreon
be paywalled
right now?
but no, yeah, but it's free every Friday, and you can come join the game. It's fun. So it's over on my personal channel. So
definitely
I know
promote
it goes in the side chat sometimes. So
yeah, no, I'm just yeah, that sounds a lot of fun.
Also,
actually.
do I have your permission to roast a chatter who's been annoying for fucking weeks and I just banned because I was annoyed?
Why is God asking our permission to?
I mean, I'm not here hosting, so if you guys had
God does make sure that we have a semblance of
silence. Just kidding. Okay. No, listen, a chatter was like, oh, just tell the kid, they can be themselves. And this person was like, oh, what if they say they're a billionaire and what do we have to give them money now? Just being the most annoying fucking person. They've been told to call in 1,000 times. And I was like, hey, how about you either shut the fuck up or call in? And they said, how about no? So you are now like banned from the show. I hope you suck sweaty farts from the asshole of a fry cook after a long shift. Like,
isn't that what essentially Trump did? Is that he identified as a billionaire for a long time until somebody just said fine and just gave him his money? Like, isn't that how that actually worked? Like,
yeah, lots of fraud. 34 counts of felony fraud for that.
Yeah,
that exactly. Kind of thing, right? So
yeah, exactly. Yeah. So I guess Trump is trans. I guess that works. Well, and you know what? I don't claim him. I don't. I take it back. Ugh. It'd be the worst thing ever to see him come out of his egg. I don't want to see it. I don't want to think of
No.
it. It is just giving me cringe all over my. No, please. That would be a fate worse than death to our community. Oh, please,
Yeah.
no, 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 no. Yeah. So also, since we're shilling, make sure that you donate to my campaign. We have another really important deadline, and the line, and this is a fun fact here. The line, the Zerba link is almost raised $10,000 in total. Like that is
Wow.
that's like nearly a quarter of all of our donations that have come in have come from the Zerba link. So the line has been an important integral part of our community for the campaign. So I really deeply appreciate it. So also if you haven't done a reoccurring contribution, we have a lot of reoccurring Zerba donors that are giving like $5 a month, and like that money is really great because it makes sure that I have like I know how much money I'm going to get every month, so that way I can like plan on that. So like electricity bills for our new office headquarters that we're about to have, and that those reoccurring donations actually help us be able to plan month after month. Even if they're $5, they all add up over time. So yeah, if you want to be able to do that, be a part of the reoccurring contribution. And once the campaign is over, we will cancel all the contributions that so therefore you don't have to worry about turning it off. So after
Josie from
the
Maryland
campaign
mentioned was on my bingo card.
Oh, was it? I didn't say Josie from Maryland. I guess I said it now.
Hey.
So see now God is rigging the bingo cards. So that's really interesting. See? Can't trust God.
You gotta put pink trombone on the bingo card because that's been a thing.
Yeah, absolutely. And on the Discord, I see that they made they made emotes of or not emotes, but emojis of Forrest wearing a dress. Did you see that, Dr. Ben? That on the Saturday Cuz I Wanna, Forrest showcased 3 dresses that he was
Oh,
wearing. Yeah,
that's cool.
very flattering. It was
Yeah,
actually
I love that.
very nice. Oh yes, absolutely. So totally had a sweater dress with pants, great date night outfit. Wore a really flowy brown dress that was really nice, and then a romper with like a little frilly sheer top to it. So I was like, all right, I appreciate his wife donating to the cause, because I'm sure Forrest stretched the shit out of her clothes, but
Yeah,
it's all in good fun.
yeah. No, Forrest is great. It's awesome that he was putting himself on the line to get some support for your campaign.
It was a big deal. It is incredibly great, and Arden has done it before as well.
Yeah.
So
Thanks, Josie, for
oh,
mentioning. Thanks for remembering. I know Forrest is so special, but thanks. I'm glad you
Arden, you were an
remember.
OG. You're the OG.
That's
You were
right.
a donor before most people on the line were.
That's right.
So don't I think you were one of the first Zerba donors, actually, because I needed to test something out. You donated, and I really appreciated that.
True. All right, let's hit supers, and then if we have to vamp towards the end, we can as well. But we're gonna hit supers. All super
Cool.
chats of $5 or more, we'll read out live, starting now.
All right. 5 pounds from Mystic Mind Analysis. How many trans women does it take to screw in a light bulb? Just one. Even without the bulb, call her a good girl and she'll smile and light up the room. Oh, that's
Aw.
cute. That's super great.
5 pounds from Sean Loves Maths. The number N exclamation M exclamation point to the N always divides M and factorial. Please search It sure would. Final stretch of PhD to help with my maths PhD. I'm investing in the super chat. Yeah,
Oh,
if you go
nice.
support Sean in the math PhD, that's a lot of work.
Yeah, Sean's gonna come up with the formula for everything. It's great. I'm
Yeah.
ready. I'm ready for this. In fact, I expect it, Sean. I expect it. If you don't, I'm just gonna be disappointed in you. I'll just give you a shaking head of what was that PhD for? No, I love you. Um, yeah. So make sure you do that. Is this the same one or is this a new one?
That was the same one.
Okay.
Wait, no, it's also from Sean, but it's a
Oh,
different.
Oh,
it's a
this is a
different
different
one.
one. Never
Oh
mind.
yeah, £5 from Sean Loves Maths. Open problem is 11 to the nth plus n is even ever prime for natural n. But seriously, please search Isherwood's final stretch for PhD. Thank you. I will search. I will search.
$5 from Detroit Atheist Queen 247. My niece, who's a cis woman, had to have puberty blockers because when she was about 5 years old, she started developing breasts, etc. Yeah, it is a legitimate medical therapy for cis people and for trans people. So it's just wild that people are so against it when it comes to trans people, but cis people can have whatever they want. But trans people, no, it's icky when trans people do it.
Mhm. 10 CHFs from Astronautic. So trans minors can't consent to blockers slash HRT, but somehow cis kids can consent to androgynous puberty blockers are the natural option. Forcing kids into puberty they don't want is not. Hashtag Team Ben. Exactly.
Yeah.
Exactly.
Thanks for the vote. Appreciate it.
Yeah, that 5-year-old girl, she couldn't consent to not have boobs. It's her fault to
Yeah.
have them now. Yeah, it's freaking terrible.
$5 from Joshua Everett 9887. The location of the boatgina is obvious. The boaterist. It's the boaterist that forever remains elusive. Hashtag Team Josie. Oh no.
That's a good one. I approve. I approve. It's great.
Boatgina.
The boat ginus and the boaterist.
That's
Everybody
Josie's
knows who
team
the
now. Hashtag Boatgina.
Hashtag boatgina. No.
Oh, there's so my navy brain just went in so many bad directions at once. I literally had a crash in my head. I just could not. Just because you can't take the sailor out of the girl. The jokes that come into my head that never leave my lips. Anyways, I think this one's me. $5
Yep.
from Detroit at Atheist Queen 247. Everybody sings along with me. Doe, a deer, a female deer. Ray, a pocket full of sun. Hashtag Dr. Ben, I always forget.
Thank you
That's
for the
fair.
vote. Thank you
Yeah,
for the
it's
vote.
obvious. It's a doe,
Yeah.
a deer, a female deer. All
Yeah.
right. Like
It reminds me of the adult human chicken thing that was a joke for such a while.
Oh my god.
$9.99 from Snard Fluke Louise Richardson. Hashtag Team Josie. I can't think of anything clever. Maybe later.
Aw. Thank you. $5 from Joshua Everett. Is it Rob Petier? Petrie? Petrie? If you get this joke, you are ancient, but super cool. Or both. Hashtag Team Josie. Oh my gosh. I don't
I don't get
know.
it.
I don't know the joke because I was thinking like Tim, but but it's not Rob. So now I'm confused. Dang it. I'm not cool or old enough. That's a first because I am not cool. That's an always, but not old enough. That's oof, too many times.
Sorry, I was harassing some loser in chat. What did I add the point
It's
there?
my point. No, you didn't.
Okay.
Yeah.
Stuffing the ballot box. $10 from Beaker Squeakers. I feel you on those backseat experts. I can't tell you how many times lay people have tried to argue with me as an engineer because Chat GPT said so. Shaking my head, hashtag Team Ben. Yeah, I hate it. Like the
Ugh.
Dunning-Kruger. I know everyone's gonna have a little Dunning-Kruger about something, but like have the humility, like when you're being corrected by someone who's in that field, like maybe don't push back so hard that you're right and they're not. Like, especially if you
Yeah.
can't bring receipts. Like if you can bring a citation, like bring a citation, but don't just think your opinion matters because you did a Google.
Yeah. But they did a Google.
Yeah.
4.99 dollars from at clarification. Terms like buck and doe exist entirely for trading animal parts for or breeding livestock. The attempt to equate that to human gender implications. Squirrely eyes.
Yeah,
Yes.
yikes.
Yeah, it's a big yikesy.
$5 from Legally Mod. After that call, I bet if you called Bill a good girl, he'd melt. Hashtag Team Josie. I don't know. It seems like Bill doesn't really have a gender preference.
Yeah. I think Bill might be agender. Like I'm starting to understand agender people more and more I do this show. Like it's just like I didn't understand gender people, agender folks for a while, for a long time, probably early in my transition and maybe up to a few years ago. But now, after doing this show, I am convinced there is a large contingency of agender people that exist in the world, like a large amount, and they're attracted to this show to argue about gender because they just don't understand it themselves. Like I am convinced that that is part of the problem. And it's not a problem to be agender, it's just a problem to not accept that the fact that you might be.
Yeah.
Yeah. 4.99 from the Chimera. Arden, smite me, almighty smiter. Hashtag Dr. Ben.
Consider yourself smote.
I love it. So good.
That's hilarious. $5 from at EB334. Pink trombone with the reverb. Hashtag Team Voice of God. Damn. You're just trying to torture us today.
Yeah.
Wait, can I make this happen? Hold on.
And
Give me a
can you make
second.
it happen?
Give me a
All right.
second, chat. I can make this happen. Hold on.
Oh, by the way, some folks are actually doing recurring contributions right now. Like I am loving
That's
all of
awesome.
you so much.
That's
I know.
awesome.
It really is. I love all of you so much. Ah!
The reverb.
I kind of hear the reverb.
Yeah.
Oh my god.
Okay, I'm done.
Are we ever really done? You know, it'd be really funny. You know, it'd be really funny punishment one of these days. Like make the argument like a concentration game where you have to give your argument while Arden does that in the back.
Oh god. Oh god. Yeah,
The audio just goes to the person doing it too. I don't want anyone else to hear. They just have to watch them struggle.
Oh god.
It's so funny. I think
Gosh.
is this one mine? Or is it
Yes.
yours?
Is it yours?
$5 from I don't know. I'm just gonna read it. 5 from Ollie Achana Silverbow. A transgender man went to his therapist and then his doctor. He said the same thing to both of them. I need to get something off my chest. Hashtag Team Ben. I love that one.
That's a good one.
And thank you for the vote.
Oh, $5. Oh my god, I'm like yawning. $5 from Detroit Atheist Queen. My youngest came out to me around 6 years. Didn't know how to explain what they were feeling. It took time to get there. Hashtag Team Dr. Ben.
Thank you for the vote.
Yeah.
Two
Oh
hundred
man, it's
twenty.
all this
Yeah,
love for you.
yeah. It's I mean, sometimes I feel like I'm cool. Some days I don't. Last time I lost to Lux. So uh, 220 TRY. I don't know what place that's from. From Elira 1982. I've been accepting of everyone, whoever they were, all my life, except for myself, until I found you guys a couple of years back. And the words for who I really was, finally. I'm glad you do what you do. Hashtag Team Dr. Ben. Big hugs. I love all the stories of people's eggs cracking in our side
Yeah.
chat. It's really nice.
Yeah, it is nice. $5 from B Bunny, 1982. Hashtag Dr. Ben. I see you, chat. Where's my
They're
Team
all just really
Josies?
they're all just really offended that you abandoned them at the end of the show last time.
Yeah. You know
They're
what?
like,
I
you
should
got to
have
get extra
said,
punished.
yeah, the hell with it. Next time I'll just burn.
$5 from Joshua Everett. Arden for Earth Queen, Josie for Earth Prime Minister, Dr. Ben for Arbiter of All Life. Hashtag Team Josie. I get to be the Arbiter of All Life. That's cool. And you still vote for Josie. Like, okay.
Yeah. I don't know. Do you want that responsibility? I guess you are a doctor, so I guess you do choose to arbiter some people's
guess.
lives. $10 from B Bunny 1982. Sorry I didn't get to call in time. I tried. Sorry, I was up really late last night with fundraising stuff. I tried right after it closed. Was about discrimination at work. I may try again next week. Kind of wanted to talk to someone who knew the laws a little. Yeah, call in next week. I'm sure somebody can maybe help you out.
Yeah.
I'm sorry you're dealing with that.
$5 from Mira Featherbender. Oh, hi, what's this? Mira G fixed her display name. Hashtag learning, hashtag fight for gender, hashtag Coliseum, hashtag Team Lulzy. There you go. You got your vote for Lulzy.
I love the Lolzy. It's so good.
Wait, who is this vote go to? I don't even
It's
completely
me.
know.
I'm
Josie.
Lolzy. I'm like
Oh,
Lulzy.
okay. I
Lolzy
gotcha.
because that's what one of the emojis in the chat. What it's an image of me, but it's a call to Lolzy.
Oh,
Lulzy.
wait, where is
A
this? Is in
Lolzy.
the Discord, you said?
Yeah. You don't
Oh,
know
okay.
about this? How does God? I thought God was omnipresent. What the hell is going on right
No,
now?
not this God. I there's no logical contradiction to this God. I definitely don't know everything, but I am all powerful.
You're not supposed to say that out loud. That ruins the mystique of being God.
I'm also not
Yeah.
like perfectly rational or moral, so I don't think about those kinds of things. You know, I just kind of I'm like
clearly not.
I'm like a
perfectly
Greek or
moral.
Roman God. I just kind of fuck around and find out, really.
Yeah. If you were gonna be in a pantheon of gods, what's the point of being a god? Like you want in on the Real Housewives of Mount Olympus. That's what it would be about. Like it's like who wouldn't want to be a god during that time? That's where all the drama happened.
That is what I'm
Right.
here for. I'm not here for the all powerful, you know, fuck humans. You guys have been a mess, but you know what? I am here for the drama.
Yeah, it's like the drama of Mount Olympus, nothing better.
Right.
Five.
Oh, that's you. Okay.
Yeah, 5 California, Canadian, Californian.
California dollars.
We wish, if only. From Quantum Chaos, 2 weeks ago, Arden skipped my super, which was a vote for Ben, leading to him losing by 1. She rigged the election for Lux to win anyways. Hashtag Team Josie.
So now you don't even give me that vote back? Like you're gonna complain
No.
about rigging it
You only
in
get
Lux's
1.
favor? I only get one
Everybody gets
chance.
one. That's it. The
Votes that
chance
come
was
in
just
after the game's done don't count towards the score. If it wraps up and
Yeah.
someone wins and then you send one in, I'm sorry. That's just you
and,
not being on top of things.
and what book and verse is that written in your Bible? Because I don't know anything about this rule.
The book of Out of My Ass as I Please 317.
317.
This is canon now. $10
Yeah,
from YouTuber Grudge.
I
Got
know
a
it's
rep for
canon,
the
but
mask. Got a rep for the mask. Hashtag Team Ben. But good luck in your election, Josie. I have something planned for your campaign. Just a little something to help out, hopefully.
aw, thank you. I appreciate it. Yeah.
Thank you for the
So
vote.
make sure somebody's got to brand the Out of My Ass book of whatever Bible Arden is the god of. Uh and now you have a number 317. Remember, the voice of God, the Bible was written by God. So we already have some canon here.
Yeah.
And then
I love that we have
on the
lore.
yeah, well, in the skeptics chat, I mean, Matt better pull it out and be like, "Look, in the book Out of My Ass." It would be so good.
Yes.
5 pounds from Jessic 87. I need an anti-trans bathroom caller for bingo. Open the lines. Watch from Finland with my beautiful fiance. Hashtag Team Josie. Hashtag Discord lives matter. Yes, yes.
Closing the gap.
The fact is like I know they exist now, so they don't know when I'm lurking.
$4.99 from Bramley CX. Labubu may be the best Pokemon, but what is the worst? Hashtag Team Ben. I didn't bring my Labubu tonight. The worst one, probably Long Furby. That's definitely the worst Pokemon. My least
Long-haired
favorite.
Furby?
No, Long Furby. I have a Long Furby in the other room. Have you seen them? It's like a Furby, but a worm.
It sounds like something straight
I
out of
feel
a
like
nightmare.
I feel like I have to go grab my Long Furby.
You have, yeah, we've got time.
Yeah.
Okay, I'll
We've
be
got
right
to vamp
back.
a
I'll be
little.
right
Go
back.
ahead and grab it. Josie, you
Oh,
haven't seen the
hey,
long Furbies?
I haven't seen the long Furbies, and vamping is a bingo card, so I have to do it for like a minute or a full minute. I can't remember, but I am vamping. Make sure that you got to vamp.
John
So,
Green did a video, I think, on a long Furby where it was like it looked like it was made out of baked beans. It's
oh,
horrible.
really?
It's like people take those like posable like stuffed animal spines where they're like interlocking little things, and they just put like a whole bunch of them together and then restitch the Furby together so it just looks like a giant super long Furby.
Oh, that sounds horrifying.
It is a
Like,
little bit, and it's
is
also
it like
fun.
it's like it's like human centipede level horrifying.
Yes.
Oh my god.
And that's not even
That's
like a
scary.
super long one, to be honest. I feel like I've seen way
That
longer.
Oh yeah,
that's
there are longer
scarier
ones,
than I
but this
thought it
was
would be.
yeah, they're like you have to hand make them, and so this was like $100.
Right.
Oh my
Like
god.
so I couldn't get a more expensive one.
Wait,
But
it was
you
so
can
it
move
sound
it.
it looks like a demon from an anime. Like I feel like it
Yeah,
must be exercised.
I got this one because he looked very distressed, and that was my emotional
And
feeling at that time.
why is it not around your neck? Like you should just like put it
Because
like you're
it's
wearing it like
I
a like
could. You gotta
there.
see the face
Yes.
though.
You got to see the face. There it
Yeah,
is.
yeah, we're
So,
doing this
yes.
fashion
That's
statement.
what's happening. Yeah, yeah,
Fashion.
for sure. For sure. Now you have the curse of whatever the long Furby puts on you. It's weighing on your shoulders. I literally can see it.
Yeah.
$5 from Detroit Atheist Queen. Sorry, I don't know why I was like reading it weird. I meant to say come out around 6 years old. Hashtag Team Dr. Ben. I knew that's what you meant, and you scorned me by giving a point to Dr. Ben. I see you. I see you, Atheist Queen. I see you.
$5 from Mr. Boricua 10. hashtag Team Dr. Ben just to double trouble against Josie. You know, I'm not mad about that. We can doubly punish Josie. I think we should.
Okay, I have a thought because it's still really early and because lines would just not fill up even when I had them open again. Um, I think you guys should vamp for a little more. We'll end the competition at like 52. So it's 4:44
Okay.
right now. At 4:52 we'll end the competition. So that gives you guys another like 8 minutes to send super chats to keep this vote rolling. So if you guys want to vamp for a couple minutes, we'll
Yeah.
let some super chats roll in. I need to actually step away for a second, and then we'll keep the score going. Okay.
Fair enough. Dr. Ben, somebody said in the chat that the worst Pokemon is actually Trump. I kind of agree, right? But wouldn't that necessitate the fact that we could put him in a Pokeball and forget him
Yeah,
forever?
I just didn't want to accept that he was a Pokemon. Like, I'm in denial about that.
Well, the thing around your neck is a Pokemon to you, so
Yeah, and so is the Labubu. So
ugh.
yeah.
Yeah. My God. The Labubu Pokemon. This is too much trouble. Too much trouble. So since we're vamping, Dr. Ben, what video games are you playing these days?
Ooh, I've been playing Star Wars: The Old Republic, and actually, I've been playing Star Wars: The Old Republic on stream on Sundays, and we're trying to start a guild. So come join us in our guild. But what other games have I been playing lately? Oh, there's this is so. I don't feel bad saying this on stream because I don't work for any government anything now. But there's this
True.
game called Schedule One, and it's literally a drug dealing game. And they added mushrooms to it. It's
Is that
such a
game like
funny
really,
game.
really old? Is it like an old game? Hasn't that been around for a while, or am I thinking of some
It's
other
been around
game?
for a little while. It's not
It's
super
like
old, but
it's like text-based, right? It's a text-based?
no, this one's like like the art is kind of on the lower quality end, but oh no, I lost Greg. No, but it's kind of a goofy game. I don't know
Okay.
I don't remember when it came out, but it's
I
kind
remember
of
there was like a
silly.
Flash game. I remember there was a Flash game that was
Mm.
like a drug dealing game. I remember like we're talking about old school internet days, like college
Yeah, no,
humor was a thing.
this is not that old. No.
Oh, okay, okay. Well, I'm still playing Expedition 33. I'm still doing that. That's that game is actually really great story. I just like I like the game, don't get me wrong, and I'm getting better at it, and I'm almost through it. I'm in Act 3, but I just don't like that I have to parry all the time. Like I get so frustrated. Have you played Expedition 33?
I have not played it. No.
Oh, okay. It's like game of the year. Like it's a good game, don't get me wrong.
Mm.
It's just a very different game to get into after beating Silksong. Yes, I beat Silksong. I feel like I'm a real gamer because I can beat a game like Silksong. I don't know. It's a tough one. It's a tough one.
Yeah, I
Um
mean, I got a lot more time to play games now. So
yeah.
All right,
Yeah,
let's
exactly.
sorry, I'm back. Let's hit this super chat. I
all
realized
right.
it was coming up as less than 5 USD, but I'd been done a couple of 5 Canadian. So for Olivia, I will send your 5,000 Argentinian, I think it's pesos through.
Yeah. So 5,000 through and 5,000 votes for Josie. Argentinian votes are all worth extra. So Olivia, this is the most I can I guess SC. So
Oh,
hashtag Team
super chat.
Josie. Oh, super chat. Hope it gets counted. I hope it did too, and it has. But Arden's not giving me the full
It's
5,000 votes.
rigged. Rigged election. That wasn't even supposed to go through, and then Josie gets a vote for it, and then somebody else like compensated for that
Of
one.
course.
So this is so rigged. $5 from Legally Mod. Arden's source is she made it the fuck up. At Team Josie. That's no hashtag no vote.
No hashtag no vote.
No, you can't take that away from
Oh,
me.
I believe
Them's the rules, sister.
that's on the
That's been the
bingo
rules
card,
forever.
or they're gonna make it a bit on the bingo card.
Oh my god, they are gonna make it a bit the bingo card because
But no hashtag,
honestly,
no vote.
everybody knows that they have to fill in the dot when you're voting. You can't put a check, you can't put a big X. You have to fill in the dot. I get it. All right. I get it. I accept I accept it, but I will legally challenge it because it's legally mod. And if it comes down to one vote, I will bring the full force of
No.
law.
No. You don't get to do that because you already got the vote that shouldn't have made it into the super chat. So you're already benefiting when you shouldn't
Yeah.
have. This is so
Yeah.
rigged.
And so now you get to read this one
Okay.
then.
10 Canadian Californian from Ayla says hashtag Team Josie for Olivia. Yeah, so this is the compensation for the one that wasn't going to count for Olivia and then did. So there you go.
It's time
hope
to
you're
legally
happy.
challenge a recount right now. $5 Canadian from Quantum Chaos. Josie, you're thinking of Dope Wars. I am, and that is a deep cut. That's really great. But why did you give it the hashtag Team Dr. Ben when it was my deep cut that I was bringing forward?
Because you already benefited more than you needed to from this rigged election. 220 Turkish liras from a lira 1982. Hashtag Team Josie. It's so inspiring to watch your journey on the political stage, Josie. I'm looking forward to the day trans people won't be so stigmatized over here. Please keep shining so brightly. That was wholesome.
Aw, thank
Except
you.
for the hashtag Team Josie part. That
That
part
was the
didn't need to
best
be
part.
there, but that part didn't need to be there.
Yeah, thank you. $5 from Myra Featherbender for legally mod. Hashtag Team Lozy. Hashtag Team Josie. Hashtag Team Josie. Hashtag Arden made it up. Yes, Arden always makes it up. Like the fact that Baldur's Gate is a bad game. The worst take that has ever been made. Ever.
Yeah, for real.
It's like, come on. It's a game of our generation.
The game of a generation of losers who play bad games.
$5 from the Schmoopsy. Josie got my political donation, so hashtag Team Dr. Ben gets my vote. See, there we go. We're meet in the middle. That's fine.
We got less than a minute left until voting closes, folks. So get those last ones in.
As long as they're postmarked, we're good.
That's not the rules on this channel. Not in the US anymore either.
Not in the,
I know. They just changed the law. It's horrifying. All right. $5 from YouTuber Grudge. Hashtag Team Dr. Ben. I will be graduating this year to become an electrician with an associate's degree. Hashtag Long Furby.
Congrats on your associates. It's awesome.
Yeah, super congratulations.
All right. That is time. Voting is closed. You can send more super chats if you want, but they will not count towards the vote. Josie has taken another L. Usual Josie L on the TACIS here.
Oh my
Greg
God.
helped me win today. Thank you, Greg.
The only way you're gonna soothe my heart, everyone, is to donate to the Zerba link that I just posted. That's the only way. That's the only way. Or I'm just gonna be sad and cry.
And the position that Josie has to defend, according to our chat poll, thanks chat for participating, is ally card requires a monthly quiz. So let me get that all set up for you, Josie. Are you ready to defend your position?
I am ready.
All right.
I'm ready for this one.
Let's charge up the clock. And 3, 2, 1, go.
So we have seen much evidence of how language changes and how people don't change with that language. So like when we are talking about the queer community, there are still people out there that be like, isn't queer like a slur? It's like, no, it's part of the queer community. It's a thing that we reclaim. So you can say it now. It's fine. It's okay. It's great. Do it. So that's a question on the quiz. Is queer a slur? Next question on the quiz would be, is there more than 3 genders, right? We gotta ask the questions, the hard hitting questions. Keep the allies on our toes, right? We gotta make it happen. Is gender expression and gender identity different? These are all important questions that we must know before you are given an honorary gold star in the mail. And that gold star must be worn at all times, or we are just going to assume that you are not an ally and do not deserve our respect. And people say, "Oh, well, you're pointing out the gold stars on people that are cool." Yes, it's easier for us. We're tired of it being the other way around. We can then look right at you and be like, "Oh, you took the monthly quiz. Congratulations." And every time you get a star, it might be gold sometimes, or it might be yellow, it might be blue, it might be pink. The star changes every month. So we know when you assholes are putting on a different star because you haven't done your monthly quiz, which makes you worse as an ally because you're trying to get by us knowing that you didn't do your monthly quiz for February 2026 when it's coming up. So you better get your pencil sharpened because we're taking grades and we're taking names. And if you fail, well, you're just not going to be our friends anymore. And you can't sit at the cool kid table. And I'm not sorry for that.
She's not sorry. She's
I'm
not
not.
sorry that you don't get to be at the cool kid table.
That's right.
That's got to be your new
'Cause you don't got
campaign
your
slogan.
star.
Josie Caballero is not sorry.
I love that.
Oh my gosh, I love it. Thank you everybody for watching the show. Make sure you subscribe to our Patreon. And make sure if you haven't liked and subscribed, make sure you do that. There's still time to share. Just because the show's ending doesn't mean you can't share it. It's important. Do it. Even if you just click the little share button and you just copy it in your little tab, it actually counts as a share. So do it.
Yeah.
Make the algorithm love us. We are almost at 20,000 subscribers. That is a big deal. It's a big deal. And I'm in a petition to take the new YouTube button, whatever it is. I'll just put it right here, and it can be mine, and nobody else's, because that's just how it should be. That's right. So yes, everybody, thank you so much. And I'm trying to see, are we supposed to end right at 4 minutes? Because I think I put my end voice on too soon, and it just made it awkward for everybody.
We do have to end in 4 minutes exactly, but that's okay. Also, somebody said no stars for the Harry Potter allies, and I totally agree. Yeah, if you're posting up that new
Yes.
Harry Potter show, your card
Yeah.
evaporates. It bursts into flames in your hand.
It burst into flames. Like, yeah, it's actually dangerous. And you know what? We should make the stars burst into flames too if you don't re-up them. If you wear them on a day that you're not supposed to wear them, whether invalid, burst into flames. So you like that blouse? Got a hole in it now. Can't lie. That's how it works.
Yeah, I guess that's how the world works now.
Yeah.
Now's a good time to
Yeah,
remind
just-
people that if you stick around after the chat ends, you are going to get automatically sent over to Calling It Now with the Jimmy and Luxander. So if you wish Luxander was here today and you didn't get to talk to it, that's okay. It's over on Calling It Now, and you'll be able to talk to it in like 3 minutes. So, well, I'm sure they won't be taking calls that quickly, but yeah, you can get in line to talk to Lux that quickly. So
Yeah.
Yeah. Yeah. I think somebody says, is Josie playing a pyro bard now in IRL? I mean, I'm not. If I was that, why would I say that that's happening? Because everybody knows a good pyro bard is going to not say they're a pyro bard.
Yeah. Yeah.
But
That's
like
a good point.
it's too much evidence. Somebody else did it. It was Dr. Ben. Dr. Ben put a hole in your blouse.
I'm getting framed. It was Greg.
No.
I'm not afraid to say it was Greg. It was definitely Greg.
Yeah.
no,
yeah,
honestly, that
but,
checks out.
It
Yeah.
does check out. I
Greg
can
and my
hear Greg saying
Labubu.
burn it
Yeah.
right now. Like
Yeah, Greg and my Labubu have both just been causing chaos, and I should not have let this demonic energy in my house.
Yeah, you've been cursed. You literally put the curse on your shoulders. Like you
Yeah,
probably feel heavier now.
I do. Yeah, I
Like
have to go
yeah, yeah.
cleanse.
Yeah. Well,
Yeah.
there's no cleansing that kind of curse. There's like
Right.
you're like the only way that curse is removed from the sweet release of death, and that's a long time from now, Dr. Ben.
Yeah. We'll see. It might not take that long for Greg to end it all right here.
That's true. Oh my gosh. All right. And yeah, there's the purple screen. It is time to actually put on subscribe to the Patreon. Make sure you go to subscribe to Dr. Ben's channel. Make sure you also donate to my campaign. Do it now. It's making it real. And I love all of you, and it was a great show, and I will see you when I see you again. I love you, everybody. Bye.